complete in case they throw that to you on a test. Right? So what they'll do, they'll give you your 4 answer choices. And if it's something that you have absolutely no idea what the answer is, and there's something on there like pleomorphic, you're like, oh shit, I never saw that before. That's probably the answer, right? So I try and give you some of that so that you can understand how the test tries to distract you, right? And you know, try and guide you toward at least getting your answer choices down to the 2 best, right? So that's just, you know, that's just your bacteria. Gram-positive organisms. This is something I wish somebody had told me when I was here. It would have made my life so simple, okay? All gram-positive organisms, the genus ends in US or UM, okay? Except for Listeria. You're gonna see Listeria is an exception to a lot of rules. Okay, other exceptions are Haemophilus and Proteus, which are gram-negative. But if you look here, you've got your Streptococcus, Staphylococcus, Bacillus, Clostridium, Corynebacterium, US or UM. And where this is important is if you're taking the test and in the text of the question, they say, you know, blah, 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 this gram-negative organism, right? And they give you 2 of these in the answer choices. You know these are gram-positive, you can wipe them out right away, okay? So gram-positive organisms, those that are cocci and those that are rods. There are less gram-positives that we'll look at than gram-negatives. That's just because these particular gram-positive organisms are the ones we're most concerned with that are pathogenic to humans. Okay, so the gram-positives, staph and strep, and the gram-positive rods then are further broken down into those that form spores and those that don't form spores. Bacillus and Clostridium are spore formers. Listeria and Corynebacterium are non-spore formers. You guys hear about Listeria, right? In the news, right? Inevitably there's a recall somewhere from like a cheese factory or someplace where they're processing cold cuts, and that's because they tend to grow in colder environments. And we'll talk a little bit more about that when we get to Listeria. Gram-negative organisms. Okay, they can be cocci, rods, or spiral. Okay, example of gram-negative cocci is Neisseria. It's the only one for gram-negative cocci that you need to know. Okay, they cause gonorrhea and meningitis. The spirochetes. Okay, we start talking about spirochetes. We start talking about the Lyme disease, babesia, those kind of things that are spirochete driven. And then gram-negative rods, the Enterobacteriaceae. Okay? And then I put some things in here because we used to have labs, and again, I throw them in here just in case that's something that they put into the text of the question. These guys can only be viewed by dark field microscopy. What that means is they can't be gram stained, right? They don't pick up a gram stain so that you can see if it's purple or red under the microscope. And that whole thing with purple or red with gram stain, those are the stains that are used. All that means is what the cell wall is made up of will allow one stain to take as opposed to another stain to take. Okay, because the cell walls or the cell membranes of gram positives and gram negatives are different. Endotoxins. Okay, endotoxins are also called lipopolysaccharides. It's a major component makeup of the outer cell membrane of gram-negative bacteria, and it's released when the cell is broken up. Okay, you may even hear. I've heard some of this in the news lately about some different things too, about endotoxins. Limulus amebocyte lysate assay. That's the test for endotoxins, and what it does is it takes blood from the horseshoe crab, mixes it up, and then you see whether the cells get lysed or not. Okay. Terminology: endotoxemia is the presence of endotoxins in the blood, which can lead to septic shock. Septicemia, septic shock, right? You'll hear some of those terms. One of the other things that I'll try and do is I'll point out, like, look, I know we're here to do all this today. After you take this test, you can forget probably 70% of what we talk about today, right? Hopefully you get enough of the basis, because there are some times that microbiology will come into play in your practice, you know, and this knowledge, especially when you're dealing with things like Lyme, or you're dealing with people that have had sepsis, people that have come in that might have some sort of infection. I mean, look, let's be honest. Are you gonna have somebody come into your office and be like, and you're gonna look in their throat, and, oh my God, they have diphtheria? Probably not, right? So take this with a grain of salt. I'm gonna try and give you some clinical things or some examples from my crazy life, and maybe when you're taking the test, you're like, oh yeah, I remember Dr. Freeley had a crazy story about this. The answer is diphtheria, right? This is microbiology related, but it's more for you guys for clinical knowledge, okay? You've heard about sepsis. You've heard about people that have died from sepsis, okay? Sepsis has phases based on your immune response, okay? Based on your neutrophil counts, right? Your white blood cell counts going off the charts. So when you start out with sepsis, you'll see that there's, you know, body has systemic inflammation. It's reactive, right? You have fevers, you have chills, those kind of things. And usually it's because you know that there's some sort of infection. It's a staph infection, it's a urinary tract infection, E. coli, it's something like that. The next phase is severe sepsis, and now you start adding in organ dysfunction. Okay, you start to see things like elevation of liver enzymes, decrease in heart rate, okay, decrease in urinary output. Okay, so you're starting to see that the organs are starting to suffer. And then when you go into true septic shock, this is where things are really dangerous. Okay, your blood pressure bottoms out, you're not getting blood flow to your organs, things can start to die. This is just terminology here. My mom has struggled with urinary tract infections in her senior years. She has had severe sepsis and or septic shock twice. I'd say she's like Morris the cat. She's got 9 lives, and she shouldn't be here right now. The last time was a kidney stone procedure where they went in with a laser to try and get a huge stone that was like the size of my thumb. And the irrigation with the laser took the infection that was building up in and around the stone and drove it through her system. And within hours, she was near death. I actually, at 2 o'clock in the morning, I said goodbye to her at the emergency room because I didn't think she'd be there when I got back in 2 or 3 hours. The doctor said that, you know, she should not have survived. Her white count, okay? White count, what's your white count normal overall supposed to be? Less than 10 really, right? Once you start getting to 12 to 15, that's where you start seeing this kind of reaction in the body. Her white count topped out at something like 34,000. Like, she should not be here, okay? Those are things that you'll hear about from your patients. You know, people that have been sick, people that are, you know, physically trying to recover from something like that. You know, as their muscles and their joints and everything start to come back, as they start to, you know, they've been in bed. Now, it doesn't take too long to be in a hospital bed before your body starts to decondition. Those are the kind of people that you might see walking into your practice saying, man, I just hurt all over, like, help me, right? And that's where you get in with adjusting and start to strengthen and work on reconditioning their bodies. So just wanted to throw that one out to you. Exotoxins, okay, as opposed to endotoxins. Exotoxins are proteins that are released by both gram-negative and gram-positive bacteria. I'll show you, there's only a few that we're concerned with that are gram-negative. The majority of these are gram-positive, right? So exotoxins are released by all gram-positive organisms, again, except Listeria. Listeria is going to be the exception to the rule almost all the way through this. So those 2 gram-negatives that release exotoxin, okay, Vibrio cholera and E. coli. There are neurotoxins. Botulism, tetanus, and anthrax are neurotoxins. Enterotoxins, the ones that cause disturbance in your gut, okay, they cause diarrhea. The 2 gram-negatives, as well as Campylobacter jejuni, Shigella, and those that cause food poisoning, B. cereus and Staph aureus. Okay, and then there are pyrogenic exotoxins. Those are the ones that cause fevers. Okay, rash and fever like toxic shock syndrome. Toxic shock syndrome we associate with most often staph, right? And that's from tampon use. Predominantly, that's what that's the answer. That's what about. If they're looking for it on a test, toxic shock syndrome can come from other sources, but that's the answer they're looking for. It's from tampons. Just a quick slide on the comparison so you can see it, all in one place. Okay. Exotoxins, both gram-negative and gram-positive. Endotoxins are gram-negative only. These are released from the cell. Endotoxins actually are part of the cell wall. Again, they're released by lysis. Okay, there's a lot. There's only one type of endotoxin. These are easily destroyed by heat. These are not easily destroyed by heat. So you can kind of go through this a little bit just to look at your comparisons. About vaccines, toxoid vaccines are a subtype of vaccines. I think all of us now, I don't think we have to talk about COVID. I don't think we have to talk about the types of vaccines or the merits, everything that's going on in the news. I live in Rockland County. Measles outbreak, first polio case in the country in like 30 years, right? Due to the population of the Hasidic Orthodox Jewish population that resides predominantly in that Rockland County area, because of their resistance to vaccination. Again, not here to talk about merits or whatever of vaccines, but understand what those vaccines have done over the years for certain things. Of course, with COVID, resistance is around the newness of it, right? And it's like, oh my God, this is something brand new, mRNA vaccine, never heard of that. So, we'll start to see, again, another evolution in vaccines probably coming toward the end of the year to combat all these subtypes of COVID. But we'll talk a little bit more, I'll mention some things about vaccinations at the end. All right, so let's get into the nitty-gritty of the bacteria. All right, so we're going to do gram-positives first. We're going to start with staph and strep. This is just something that I put up there. Again, this is a little bit of laboratory, but what I'm trying to get you to understand here is that when you get to the ones, there's alpha hemolytic, beta hemolytic, and gamma hemolytic streptococcus. Okay, beta hemolytic strep are the most pathogenic. Okay, so this category here. Okay, and what it looks like, just so that you understand, the way you grow these in the laboratory is on a blood agar plate. That's where we're talking about hemolysis. These guys chew up blood cells, right? So here, alpha, you'll see it grows on top of the medium, has a little bit of a green sheen, but it doesn't hemolyze the blood. Okay, partial, just see that little halo around there? Beta hemolytic strep completely eat up the blood cells. Again, they're the most pathogenic. And then gamma hemolytic will grow on the medium, but there'll be no hemolysis. So let's talk about the streps. Okay, and I do this for one reason and one reason only. I don't care that you know the group, okay, or the Lansfield antigens, like if you've heard those kind of terms. I put this on here because of this one right here. B for baby. Group B strep are B beta hemolytic, and they cause neonatal infections. Okay, so you always want to think about that. Group B strep, B for baby. Takes you right to it, and you'll remember, right, that it's strep agalactiae that can be passed from the mom to the baby during birth. That's why pregnant women, they're tested to see if they're strep positive, because they can harbor some of this infection, and they'll do prophylactic antibiotic treatment of the mother before she gives birth, so that she doesn't pass it to the baby. Jumping back up to the top here, another beta hemolytic. These are the ones that are the bad guys, right? Strep pyogenes, okay? This is associated with rheumatic fever. Pyogenes, pyrogenic, okay, causing fever. And some of the things that you can get from those: strep throat, impetigo. Has anybody ever had impetigo? Usually, like a dirty swimming pool or something like that. It's like a rash on your skin. It can cause, guess what? Flesh-eating bacteria. necrotizing fasciitis, scarlet fever, toxic shock syndrome, and cellulitis. When you go down here to the alphas, these are the ones that are partially hemolytic, okay, not as pathogenic, okay, but these guys are all basically in your mouth, your nose, your GI tract, okay, mutans, salivarius, sanguis, mitis, intermedius, viridans. They can, because of their location in your body, cause SBE, subacute bacterial endocarditis. Okay, S mutans, if there's anything on the test about bacteria in cavities, that's your answer. Okay, again, not the only one, that's what they'll be looking for. And then if you have abscesses, like tooth abscesses, things like that in your mouth, it's usually staph intermedius. Strep intermedius. Then there's the pneumococci, which are also alpha, okay? Most common cause of bacterial meningitis in adults. Causes pneumonia, meningitis, can result in sepsis, okay? And typically in kids, causes ear infections. Okay, that's an important thing here. Okay, and then for the D group, for the gamma, the only thing you need to know about the gamma is strep bovis and it's associated with colon cancer. They say anything about colon cancer on the test, the only answer is strep bovis. Okay? Good so far? Okay, don't forget the enterococci. Okay, some of the group D streptococci were reclassified and now they're called enterococci. Microbiologists are weird people, right? And as they continue to do research on things, and as bacteria begin to mutate, create other strains, they're always renaming and reclassifying something. Okay, so in places where I've noted that throughout the presentation, in places where you may see it one term or the other, it all depends on when your test questions were formulated and how they get updated. Usually the test is about 2 years behind. So like last year when I did this, I told the class, you're probably not going to see questions on COVID. Who knows, you might see some this year. I don't think we need to cover any of that. I think everybody, I think that's ingrained in everybody right now. But like the polio outbreak recently, that'll probably catch up with maybe some more detailed questions in like a year or two on the test. These guys are common in the GI and the urinary tract, okay? And again, they can cause endocarditis, UTI from catheter insertion, okay, meningitis, and here's the interesting part, okay, found in 30 to 90% of root canals. Okay, usually when you have a root canal, you have an infection in there. So think about it this way, you've already got now ones in the mouth, right? You've got the ones that are cavities and abscesses. Okay, so start to think about it like, okay, what bacteria affect the teeth, the mouth? Okay, group it that way in your brain. Last slide here on the strep. Any place that has a smiley face, any place that has bold stuff, that's probably stuff that you want to focus on. 3 most pathogens causing meningitis in infants under 3 months. Group B strep, B for baby, strep agalactiae. Strep pneumoniae, and listeria. Here's our friend listeria again. Strep pneumonia is the most common cause of ear infections in children and the most common cause of bacterial meningitis in adults. That's why I pointed out before about ear infections in kids, how that's a little bit unique, right, to the age group. Right, strep, done. Okay, now we go on to staph. Okay, the nice part here about staph is that there aren't too many. Okay, Staph aureus. You guys have heard about MRSA and VRSA, right? MRSA is methicillin, the antibiotic that's used to treat MRSA. Methicillin-resistant Staph aureus. The V in VRSA is vancomycin, different antibiotic. Okay, again, gram-positives, they release exotoxins. Okay, this is kind of one of the unique features here. It's typically related with the scalded skin infection in infants. It's almost like a red flaking, almost like bloody skin. These guys are really, really dangerous. Okay, when you hear people die to sepsis from a staph infection, it's usually Staph aureus. Okay, they can directly invade your organs. Okay, ABE here is acute bacterial endocarditis, right? Acute bacterial endocarditis being more dangerous than subacute. Okay, septic arthritis, impetigo, okay, a couple of other things that you see there. Staph epidermidis, we all have it on our skin. Okay, it's normal flora, but it's pathogenic in somebody who's immunocompromised. Think about it this way: you go and you want to, and you need to give a blood sample. You're having blood work done. What's the first thing they do? Alcohol swab, right? They clean your skin to remove the Staph epidermidis, to remove anything on your skin, because then they're taking a needle and they're introducing it. They don't clean your skin, they introduce the needle, they risk driving that bacteria that's already on your skin into your veins. Okay. And then Staph saprophyticus, this is normal flora in the female urinary and GI tract. It is responsible for a decent percentage of urinary tract infections. Again, sexual activity increases risk. And then here, you know, this is one of those things about MRSA. A lot of people have this, carry it. They carry this as normal flora for them. And it's not pathogenic because they're not immunocompromised in any way. Okay, if you have people that get admitted to the hospital now, aside from COVID tests, I know a few years ago, that new designation, probably 10 years old, hospitalist, there's like somebody that does an intake when you are admitted to the hospital, they swab you to look to see if you carry or harbor MRSA. Because think about it, in shared hospital rooms, if you have MRSA and you're in the hospital room with somebody who's severely immunocompromised, you're sharing a bathroom, you're touching the same things, doorknobs, etc., you could pass that to your neighbor and it could be fatal for them. Right? So this is another thing that typically most hospitals will screen for. Yes?
Would we be seeing MRSA and MRSA on the test, or is it most likely going to be Staph aureus?
It'll be Staph aureus, and I mean, then they can then further break down the bacteria to see what antibiotics it is susceptible to. So for example, my mom, because of the urinary tract infection issues that she has, which a lot of older women have because of weak pelvic floor muscles, etc., some incontinence, when we do a urine sample, they do a full-on micro of it to determine if there's bacteria, what antibiotics it's susceptible to. She takes prophylactic antibiotics every single day of her life to prevent this. Because again, she had surgery last year, and they found she had what's called E. coli ESBL, which is a very highly resistant E. coli bacteria, typical in urinary tract infections. She had to be on IV antibiotics for like 3 weeks, several times a day to kill it. So they can categorize it, you know. So they'll look and they'll say, okay, it's Staph aureus, but we can give them a regular antibiotic. It hasn't morphed to the point where it's resistant to the heavy hitting antibiotics. Okay, a little bit, because I mentioned bacterial endocarditis, subacute. Anytime you see subacute for anything, think low and slow, right? And acute infections are the ones that are rapid. Those are fast. Those are the ones that can quickly result in death. Okay? And that's kind of across the board. Here it's specific to the conversation around endocarditis. But low virulence, because it's strep, right? Staph is worse. This causes a fulminant infection, okay, which is rapid, intense, severe, to the point of death. This progresses very rapidly, can spread beyond the cardiac region, and this is usually very slow. Okay? One of the other reasons why with the bacteria in your mouth, people that have weak heart valves, for example, they end up, if they have mitral prolapse, mitral regurgitation, dentists will often, I think the American Heart Association still recommends, they've changed their requirements. It used to be before and after a cleaning. Now I think it's just in front of a dental cleaning that you take antibiotics so that if anything gets broken through as they, sometimes they bleed you, right? When they do your dental cleaning, if you have anything there, you have weak heart valves, that bacteria that would normally be innocuous to most people gets into your bloodstream, but because the heart valves are weak, you can seed on the heart valves. And it can end up with something like a bacterial endocarditis. All right, bacillus. Now we're doing rods, okay? So gram-positive cocci, the spherical ones, done. That's it, staph and strep. Okay, I'm gonna try and reinforce where those breaking points are for you guys. All right, so we have the spore formers and the non-spore formers. That's from that like second or third slide. So let's talk about Clostridium. Okay, botulism, okay, can be found in soil and water, produces an exotoxin, okay, which is a neurotoxin that blocks the release of acetylcholine. In adults, when you have botulism, they term it flaccid paralysis. In babies, they call it floppy baby. This is one of those things about, it goes back 100 years, like don't feed the baby honey, right, because the spores can germinate in honey. It also goes back to the time when honey was in a can, right? So some of this old historical stuff still kind of carries through, but if they talk about anything with honey, it's botulism, and they're looking for botulism, Clostridium botulinum in a baby. Tetanus can be found in the soil. Okay, this is one of my favorite slides. Got my little joker over here. Okay, because these are some terms that you may not have heard. Okay, and boards, they love to put on like the alternative terminology that you may not have been taught in school. So I give it to you here so that you've seen it. Try and make that association. Lockjaw is pretty much the common term for what happens when you have tetanus. Trismus is another explanation, same bacteria we're looking at, and Rhizus sardonicus is the other one. And I found a new one when I was going through some of my notes. It's also called a rictus smile, R-C-T-U-S smile. So that's what I'm trying to show you there with the joker. A sardonic smile is like a sarcastic, mocking kind of smile. And they explain rictus smile here as an expression in which someone shows their teeth in a smile, but they look strange or in pain rather than looking happy and relaxed. And this is the whole thing, you step on a rusty nail. First thing they ask you when you go to the doctor, the emergency room, is have you had a tetanus shot? Even if you've had one, they're going to give you another one, okay, to try to prevent this because of its location, because you're picking it up from something on the ground. And it's normally found in dirt and soil. Clostridium perfringens, it's found in the environment, can be found in fecal matter. It's only pathogenic when it infects open wounds. And what it causes is gas gangrene or cellulitis. Myonecrosis can result in death of the muscles. Okay, it can also give you diarrhea. Hyperbaric oxygen is the treatment. Any place on boards you see hyperbaric oxygen, this is the only answer. Okay, Clostridium difficile. This is from prolonged use of antibiotics. Typically, it's clindamycin. Causes an antibiotic-related colitis. And it's usually from accidental ingestion of spores in hospitals. This is something that runs rampant in hospitals. When you guys get into billing with Medicare and doing that kind of stuff, there's a list of items in Medicare for which if patients contract and or are released from care with any one of the things on this list, Medicare does not have to pay the doctor or the facility for the treatment they've provided. Okay, and again, this is like one of those things that gets into legal battles. But some of those things on the list are a C. diff infection, bed sores, right? Things like that. They always try and put something in there so that if they don't have to pay, they're not going to pay. They know they're smart, but again, you'd have to go back. It would have to be a lawsuit to fight it. Okay, but C. diff runs rampant in hospitals. And again, think about these things as all of us here in this room that are generally normally healthy, You know, like some of these things are like, oh my God, I never want to get this. We're generally healthy. We're looking at people that are immunocompromised for some reason, that these things are, people are more susceptible to, if infected with. All right, let's do anthrax. So anthrax is of 3 types: cutaneous on the skin, pulmonary from inhalation, and gastrointestinal from ingestion. This, if you see this word, eschar, on the test, the only thing they're looking for is anthrax. Okay, and that's what the skin lesion looks like. The tissue becomes necrotic and the skin actually turns black. It's like dying. Okay? Pulmonary, if it has to be inhaled, think about anthrax. Where are you going to inhale anthrax? Okay, so one of its other names, pulmonary anthrax, is also known as wool sorter's disease or rag picker's disease. Think about people shearing sheep. Okay, and gastrointestinal is rare. It's rare that you're going to eat anthrax. Okay, but if you get it, it is often fatal. Okay, enters the bowel and spreads via the bloodstream, and ultimately, it's almost like that, like severe sepsis. It's like a rapid fulminant infection. Okay, and if you guys remember back to like 9/11, right? There was, you know, oh, there's people are mailing things and there's powders in them and, you know, all this craziness. That's what they were afraid of. They were afraid of like bioterrorism in that regard. I have a crazy friend. I have a lot of crazy friends. She's a hypochondriac. I'll talk about her again later. But she lived across the street from me. She and her husband and I had gone to first grade together. We're, you know, still best friends. They're my family. And I didn't realize she was as nutty about health stuff as she is. So shortly after 9/11, when all this stuff was in the news about mailmen handling stuff with gloves, and oh, there's white powder, and there's this, and there's that, people mailing things, and we're trying to kill us. She opened a box of Kleenex. You ever open a box of Kleenex and take the first tissue out, and there's like, you know, some debris in the air? Well, she swore her tissue box was infected with anthrax. And when I tell you, I could see from my house, we lived in a condo development, through the parking lot, I'm like, what's going on at Fred's house? Hazmat crews, ambulance, police cars. They're like, ma'am, I mean, and she's 20 years ago, so she's like late 20s, early 30s. And they're like, you open a box of tissues, there's no anthrax here. A week later, she did the same thing, called these guys again. They pulled my friend aside, they're like, listen, you need to get your wife some treatment because she's mentally ill. Like, there's no anthrax in this. And she's like, I'm gonna breathe it, oh my God, I'm gonna get pulmonary anthrax, because you're reading about all this stuff in the news. You know, all of that media stuff can kind of hype you up and make you a little crazy too. But anyway, that's my crazy friend Lily. Okay, be serious. This one is, did Tony Ross talk to you about fried rice syndrome? Okay, Chinese food, not well reheated. Okay, no? All right, so be serious. So serious. I laugh because I asked this question tonight. I know you guys are looking at this going, shit, we never saw any of this stuff.
We took micro?
Common, was you taking micro? Common cause of fried rice syndrome. We all go, we get Chinese food, right? The best part about Chinese food is the next day, right? You eat up the leftovers. Nuke the crap out of your fried rice, okay? Or put it in a pan and heat it over the stove. Make sure it's heated up really well. If you need to soften it, throw a little extra soy sauce in. Okay? What happens is the spores, okay, the spores survive and germinate as the food cools down. Okay, so I actually have had, I think probably most of us have had some sort of food poisoning at some point. As recent as within the last 2 years. I was late picking up my Chinese food order. Okay, so I went and I got the food, I came home. My mother hates cold food. So I took her plate with rice, threw it in the microwave, I'm like, here you go. And I was so hungry, I sat down and ate mine. And probably about 4 hours later, I spent the next 3 hours in the bathroom, okay? Because the rice was allowed to cool. Okay, so that B series is typically associated, they'll associate it with this fried rice with limited, self-limiting food poisoning. Okay? Goes away on its own, usually doesn't require any kind of care, any kind of fluids, you just kind of take care of it yourself and get all that stuff out of your system. Yes, sir.
What's in fried rice that causes this?
It's because of the grain. It's because of the grains and however they cook it. But that's typically what it is. Okay, again, you're thinking about things that are, grown outside, grown in soil, etc. The wheat, the whatever, however the refineries work. Typically, it doesn't happen all the time, right? But I nuke the crap out of my leftover rice. Okay, diphtheria. I mentioned this at the beginning. Okay, it's an upper respiratory infection, sore throat, fever. What's pathognomonic for diphtheria? The gray pseudomembrane. Okay, I'm gonna go to the next slide. Okay, gray pseudomembrane. Usually can kind of come across the top of the palate. Are you guys going to do an examination on somebody in your office and say, holy shit, you've got a gray pseudomembrane? No, right? Know it for the test, add it brain. Another thing that's pathognomonic for diphtheria is this characteristic bull neck. So you see it's like it's just like a generalized swelling across the throat and the upper neck. Spread by aerosolized secretions in the air, contact with contaminated objects. I think we're all like, hand sanitizer now. Largely eradicated in industrialized nations through vaccine. Okay, interestingly enough, I think in 2020 or 2021, they identified 2 cases of diphtheria. I think it was a mother and a child in Australia. They haven't been vaccinated. We start to see little pockets of these diseases that sort of reemerge. Okay, usually not to the standpoint of becoming endemic or pandemic, qualities to the population, but you will see these. Where you'll see this a lot is in underdeveloped nations, okay, where hygiene and vaccination isn't the norm. Can be fatal, okay. This is some old data just to kind of give you a benchmark from a public health standpoint. But you'll see, look at the number of COVID deaths, right? And then look at this, okay? There was a pocket in 2017 in Venezuela too, 300 cases reported there. The World Health Organization keeps all this data. You can look all this up on the CDC and World Health Organization websites. There's a couple of places in here where I'll have some websites that you can, kind of pop to and just read through a little bit. But let's talk about our friend listeria. Okay, so listeriosis is serious, but it's preventable and treatable. Interestingly, most important here when it comes to listeria is pregnant women. Listeria can cross the placenta. Okay, the elderly or immunocompromised again are at the greatest risk. Think about the high-risk foods, okay, deli meats, ready-to-eat meat products, soft cheeses. That's why they tell pregnant women to avoid soft cheeses during the course of their pregnancy. Okay, it's widely distributed in nature. It's in soil, water, vegetation. It can even be in the feces of some animals. Okay, and it's a common cause of neonatal meningitis. Okay, so your 2 most important things here are pregnant women, because it can cross the placental barrier, and then here, common cause of neonatal meningitis. Okay, and that's either through contamination from the mother or because, children's immune systems aren't developed yet. Okay, foodborne illnesses. You guys have heard about the norovirus or the Norwalk virus, right? The cruise ships, like something that usually runs rampant. There was a case, I don't know, a couple of years ago. I always talk about this because it's just gross and I love body humor. But people with the cruise ship got stranded somehow, something happened, and they were docked offshore, and there were no facilities for people to take care of their businesses. So like there were stories about them doing their business in plastic bags and tossing it overboard. It was norovirus, okay, that was running rampant on that ship. okay? Usually caused by salmonella. Sorry, I know that's two things there. Salmonella, okay, non-typhoidal salmonella. We'll talk about the differences there when we get to salmonella. Clostridium perfringens, gas gangrene, Campylobacter species, and Staph aureus. Okay, the top 5 that cause hospitalization. Okay, salmonella. Salmonella food poisoning usually results in you needing IV fluids because it's just running at you. Okay, you usually get that from like shellfish, right? You eat bad shellfish. Happened to me. Thankfully, I didn't have to go to the hospital. I went to a clam-baked lobster bake up in Milford for one of my students who had graduated from Bridgeport. And I'm about, from where she was, I'm about an hour and 20 minutes from my house. I don't know what time I ate. Of course, I'm the only one that got sick, but I was home in my house for about 10 minutes when it started. And from about 7:30 till about 4 o'clock in the morning, I was just getting rid of it. You know, and it was at a point where I was like, okay, I probably need to go to the emergency room. So, you know, 3 o'clock in the morning, mom and dad go out and get Gatorade, and, you know, all that, and I started pounding fluids so I didn't have to go to the hospital. E. coli 0157, that's a bad one. We'll talk a little bit about that in a minute. Okay, and those that cause death. Okay, so just again, level set you to kind of have an idea and be able to categorize these as to what's the most serious. And you can also look at that, I can check that link and it still works. Okay, Neisseria. Neisseria is the only gram-negative cocci, right? This is the one that you need to know. It's part of normal flora in the nasopharynx in a lot of us, okay? I mean, it's a decent percentage, up to 10%. Spread through saliva and respiratory secretions by coughing, hissing, sneezing, etc. Think about kids in daycare, right? So when the kids leave daycare, what do the workers do? They go and they spray everything down with Lysol, even toys and everything that they've played with. A lot of the things that will be in daycare will be things that can be clean, like not stuffies or things like that. That will be plastic or toys that can be washed and cleaned. A meningitis infection can be fatal within 12 hours of infection. And it initially kind of looks like the flu, right? It's fatigue, fever, headache, okay? Then you start getting the neck stiffness, right? You start thinking about your orthopedic tests. So Hall, Brzezinski, right? And again, because it can be confused with the flu, okay? It can look like Haemophilus influenza and it can look like strep pneumoniae initially. I know 2 young people who died their first year of college with this. Both home said, you know, Mom, I think I have the flu, I think I have pneumonia. And a few hours later, they were getting a call from the university that their kids were dead. Okay, high-risk groups, okay, that's also this, right? College students living in close quarters. The classic clue to an invasive infection with meningitis is the petechial rash. That's those little red spots on your skin. Okay, fulminant meningococcemia is also known as Waterhouse-Friderichsen syndrome. This is where your adrenal glands fail. Okay, so you know, kind of know that you've seen this. It's not something that you know we teach per se. But again, I want to be able to make those connections for you in case you see this on the test. Okay, there's 5 types of meningitis: bacterial, viral, parasitic, fungal, and then there's non-infectious meningitis. You can go through this, take a look at it on your own. We'll end up looking a little bit later at the Malaria fowleri when we get to the parasites. Okay, and then here, non-infectious meningitis usually is a result of cancer, immunocompromised, lupus, immunocompromised, head or brain injury, or from certain medications. Viral meningitis, okay, can be caused by our viruses: mumps, herpes, measles, influenza, West Nile virus, which is an arbovirus. And then there's this other one again. I put these on here because I know boards likes to throw this stuff. They're not going to ask you a question on this, but it may be an answer choice. right? So you'll know that you've seen it, and you'll know that it's probably not the answer you're looking for. Okay? And then just a quick comparison on bacterial versus viral. Okay? The one that's really bad is bacterial meningitis, but the ones that are caused by viruses are more common. They're self-limiting to some degree. They clear on their own in a couple of weeks. Enteroviruses are responsible for a large portion of them. Okay, those GI type viruses. Rash, sore throat. Okay, the symptoms are basically the same, except for here, this is where when it invades the meninges. That's why you're doing that's why you know your orthopedic tests. That's what they would be testing for, to see if there's inflammation in the meninges, to know if it's progressing that far. We'll also take spinal fluid, they'll analyze that. This, for some reason, common in summer and early fall. A lot of people have had viral meningitis. I always violate HIPAA when I'm here. Eric Kelly, he had viral meningitis. Eric Kelly has Sherman's disease. Eric Kelly had one of his vertebral foramen in the lumbar spine drilled out, and I think he just had it drilled out again recently, a few weeks ago. So he's like the walking case. I use him for everything. And I tell him, I'm like, listen, I just violated all your privacy rules. Pathogens causing bacterial meningitis. Okay, these guys are the ones to look at for this column. Okay, the ones to keep in your mind is the most important. Okay, and then you need to know where the groups are, what your age groups are for what's most common. Okay, here we go again. Group B, baby, strep agalactiae, strep pneumonia. Here's our friend Listeria and E. coli. Then, as you start to get into that infant child, like prepubescent time frame, these are your most commons. You'll still see group B strep on there, right, for the youngest of the group. In adolescents, it's usually meningitis or pneumonia, and then in adults, okay, you'll see it here. You can still see the group B strep there. Transmission of these is person to person, okay, except Listeria, okay, and E. coli, which are spread by eating contaminated food. Okay, and then there's another little data source there. You can pop onto that web page. Yep.
Isn't strep pneumonia the one that causes ear infections?
Yes, also ear infections.
But it also does meningitis. Okay.
Yep. Yeah, so if you go back, I'm pretty sure I have that on the list there for that one too. Okay, and now nothing says fun like talking about sexually transmitted diseases. I want to get through a few more slides. We'll take a 5-minute bio break, okay, and then we'll come back. Got to keep pounding through this. Okay, gonorrhea, the second most commonly transmitted STD. Chlamydia is number 1. Okay, and gonorrhea has different manifestations in men and women. Okay, so if you think about this, women are most likely to be asymptomatic. They don't know that they've been infected with gonorrhea. Why? Because of this, right? So a man's going to see a discharge a lot quicker than a woman is. Causes epididymitis, inflammation in the prostate, inflammation in the urethra, tightening and strictures in the urethra in men. But most of what happens to a woman who has gonorrhea is happening inside, right? You don't see it on the outside. Pelvic inflammatory disorder is just that whole categorization of all the female parts, right? And what becomes inflamed. So the endometrial lining in the uterus, salpingitis, fallopian tubes, oophorytis, okay, the ovaries. The way I always tell people to remember this, PID, pus in there, right? Think about it, right? You're gonna have, it's gonna be inside. It's not gonna be showing on the outside, okay? It can result in men in an increased risk for prostate cancer, but in women, ectopic pregnancies, they can become sterile, okay? They can get abdominal abscesses and peritonitis. And then if it affects the liver, if it gets disseminated enough through the bloodstream, again, probably won't ask you this on boards, but just throwing it out there, it's called Fitzhugh-Curtis syndrome. It affects the liver. Gonorrhea in the liver in women is called Fitzhugh-Curtis. Okay, now, what happens here? Ophthalmia neonatorum, if you learn this in any of your classes. Okay, this is why when a baby is born, one of the first things they do after they clean off all the gunk is they prophylactically treat the baby's eyes with antibiotic treatment. Okay, it's passed from the mother to the baby during birth in the birth canal. Okay, so if a mom has gonorrhea, okay, there's a problem here. If she's already pregnant, if she carries it to term, it can also be caused by chlamydia. Okay, two most common sources are Neisseria gonorrhea and chlamydia. With gonorrhea, the infection starts to show up in the baby's eyes almost immediately. With chlamydia, it's a little bit further delayed. Okay, there are viral causes as well. Okay, the gonorrhea and chlamydia are the bacterial causes, but there are also viral causes, and that can be the adenovirus or herpes simplex. Okay, so that's why babies born, they treat their eyes. All right, this guy, don't get crazy about this one. This is here again. It is so not that important in the grand scheme of things for what you're going to be asked on the test. But I know that if I didn't know the answer and I saw Moraxella catarrhalis, I'd be like, oh shit, maybe that's it. I don't remember ever hearing that before. Okay, so I'm throwing it on here. Again, they've changed the genus name. It's now called Brandhamella. So I put it on there just in case. Okay, and it causes two major things. Upper respiratory infections, usually in patients that have COPD, that have emphysema, and it can cause ear infections. Okay, these are the three main bacteria, again, under ear infections, and you see this guy is down here at the bottom. It's a significant percentage, right? If you're taking three bacteria and you're dividing it, they're approximately each about 30% or so. But I think if they're going to ask you anything about otitis media, it's going to be up here. Again, strep pneumonia, we talked about that in kids as opposed to in adults, it causes pneumonia. We'll get to Haemophilus in a minute. I am only on slide 37 of 146. No, I'm not kidding, but I am. The last part of this you're going to do on your own. Let's take 5 minutes. Everybody take a quick bio break, and then let's just jump back in. We'll start with the terrace. Okay? So we are done now with everything that is gram-positive, and we're done with gram-negative cocci. So we're going to go into the regular gram-negative routes. So far, so good? Too much? Too fast? We okay? Anybody freaking out yet? Yep. Okay. Good. It's a good level of freak out. Listen, I go home after this and I crash for 2 hours. It's like nap time. Have you had other reviews yet? For any of your other classes?
Yes.
Yeah? Is this the last one?
No, I still have one right after this.
Today? Who's today?
Oh, right.
Right after.
What time?
12:30.
No shit!
Yep.
Oh, I gotta stay.
No, he said he was gonna come early.
Oh, I gotta stay. I haven't seen Emmett in, oh my god. Well, that makes me so happy. So he's hanging in for another semester, I guess, huh? I wasn't sure if he was gonna.
None of us were.
Yeah.
This one, he told our class that he was retiring.
He's such a good dude. Have you guys ever seen him play?
He's been in a couple of big events.
We used to go, we had like a whole posse, we used to go out to Long Island to see him play. used to playing out, yeah, it was in Huntington. So it's like an hour and a half for me from
So
somewhere.
what would he do, like restaurants or? bars?
Yeah, restaurants, bars, lounges, kind of things, yeah. Yes, we used to get a whole crew, we'd all go out, and some would stay out there because they couldn't drive. Like, it was usually a good night, I mean, it wasn't a night to spend with him, but it was always good to see him play, he's so talented. And his partner's such a good guy.
They're so sweet.
Dave is such a dog. I've been out to like some family parties out there, back when I was in school. And I know his daughter was sick for a while.
You guys have with, what's it, suicide disease, nervous system disorder, where she has chronic pain.
RSD?
Yeah.
Yeah, that's what I figured, when I first heard about it, I figured, but from what? Like what?
They have.
Usually that's something from a trauma.
They thought it was Lyme, and then they couldn't find anybody, honestly, couldn't find anything that led up to it, and then she diagnosed with RSD. But she can't think of any like specific triggers that is somewhat significant, like, she's like, yeah, I put in stores, yeah, I hurt myself, but not to the extent, and she was actually at, she was informed. She was hiding out of her room.
I know, that was the shock. They went through.
That's what I think was his point when he wanted to retire, he's like, I want to be with this, stuff like that.
I would love, I have to ask him, I have to see if he has any pictures, I'd love to see her, I haven't seen her since she was a little girl.
Yeah.
She looks like David.
Oh,
Well, you know the whole story, right? Yeah. It's like crazy. So you try to explain.
It doesn't matter.
He's fantastic. I'm so excited now, and it was like I was in my house. Trying to make Jesus less of a song. We sent each other birthdays. It's called, you know, so, you guys never had it.
I've met her at some event once.
She and I, she was like, hey, my boss.
And then she's like, yeah, I tried to get a job,
So me, my class actually goes my graduation. And it's funny, like, I don't know, like, I graduated from 2004, but it's
You're
because I still do school, and I didn't realize that. Yeah. All right, so let's talk talk about the Enterobacteriaceae. Okay, so now we're doing gram-negative rods. Okay, gram-negatives, right? Endotoxin, okay, from lysis in the cell wall, right? Link that back to where we started. Okay, so E. coli, everybody's heard about E. coli. E. coli is actually normal flora of your body. E. coli 0157 is not. So again, mother to baby can pass it along, newborn, meningitis, urinary tract infections, big cause of urinary tract infections. Why? Because of the way women wipe, front to back to front, what's the right way, right? You don't want to be introducing where E. coli is part of your normal GI and urinary flora. You know, to poop into the pea shooter, you don't want to be doing that, right? So that's why women are recommended that you wipe front to back. Again, another reason why with E. coli, older women are more susceptible, right? Older women, like, look, I'm living with an 87-year-old with dementia. When people get up to a certain age, their hygiene habits are not as good as they used to be. And that includes the actual act of elimination, as well as washing hands after, stuff like that, right? So just something to think about with some of your older patients too. You know, you might get people that are suffering from urinary tract infections. There are a lot of natural alternatives and things that will help older women who suffer with urinary tract infections. Cranberry, right? And specifically from the cranberry, the extract, you can drink it. There's some in liquid form, but also pills. D-mannose is the extract from the cranberry that helps with urinary tract infections. Oh my gosh, there's something else. I'll think of it. There's something else that I haven't given my mother in a long time, but I'll remember. Megan Tabor would be mad at me that I don't remember. Klebsiella. Okay, Klebsiella is typically a nosocomial infection, hospital acquired. Okay. It's found in normal flora, but if you aspirate it, right, it goes into your lungs, and then you start coughing this gunk up, what you bring up, they call it, it looks like jelly. It looks like Smucker's jelly, red currant jelly sputum. And again, where are you going to see this? People that are really seriously sick, okay, that may already have some respiratory diseases, COPD, emphysema. You even see it with cystic fibrosis patient. Okay, this one is always a little weird. This was with the Irene Gold notes and the NPS notes, the board review, national NBS. They often in the test questions associated with alcoholics. Here, the reason, the best that we could come up with is that severe alcoholics, their nutrition is not good, right? They're immunocompromised because they're not eating well, drinking all the time. Okay, and again, this is nosocomial hospital-acquired urinary tract infection. It's also, I threw it on here again, just so that you've seen it, it's also known as Friedlander's bacillus. Okay, and then Proteus. Okay, look at this. They're all really part of us already. Okay, they can be normal flora in all of us. These guys are free living in water and soil. Proteus is very mobile. Okay, and it causes an increase in the alkalinity of your urine. It's associated with kidney stones, can be isolated from kidney stones after they've been blasted or extracted, urinary tract infections, wound infections, and sepsis. Okay, and then serratia marcescens. Serratia means red. So it produces a red or a pink pigment on a laboratory medium. These are hospital-acquired infections. These are ones you're going to get from that will grow and proliferate in damp conditions, like wet bathrooms, okay, and again, in the hospital. I'm going to go back to this slide in a minute because there's something important I want to show you. Okay, we're continuing on. There are a lot of Enterobacteriaceae in this group. Okay, these are all, again, gram-negative rods. Shigella. okay, has something called the Shiga toxin. Okay, it's usually a fecal oral route of infection. This is something, Shigella, you're gonna see in underdeveloped nations. Okay, poor sanitation, poor water treatment. It's not part of normal intestinal flora, okay? Shigella is often, the differential diagnosis there is with E. coli or E. coli 0157. So this is the important part, because E. coli is part of normal flora. Okay, this one causes a fever. Okay, it also causes bloody diarrhea with mucus and pus, similar to E. coli 0157. Okay, and that's the differentiating factor here, is that it's not part of your normal flora. Now, we're going to talk about different types of diarrhea, because nothing says fun like poop and pee, right? Salmonella typhi, okay, can cause osteomyelitis in sickle cell patients. Okay, this one is a fecal water route. Okay, salmonella, think shellfish. Okay, we'll go back to that food poisoning slide. Again, this is not part of normal intestinal flora. Okay, so the only two here that you really need to know, that you need to separate from what is normally in us, that it can affect you if you become immunocompromised, as opposed to what's being introduced, are these two guys. Okay, and really Yersinia. Salmonella typhi causes typhoid fever. Okay, it's most commonly just causes diarrhea. Okay, and then Yersinia enterocolitica is, again, fecal oral route of infection that causes acute gastroenteritis. This one, a little less important. Okay, and we'll talk, because when we get to Yersinia, then everybody gets confused. So Yersinia pestis we'll talk about later. That's with the zoonotic diseases, that's bubonic plague, right? Now, I'm going to go back one slide. So I couldn't fit them all. I used to have them all on one slide. They got really, really small, so I broke it up into 2 slides. So here's the takeaway on the Enterobacteriaceae. UTI, 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 okay? Diarrhea, okay? These guys cause urinary tract infections and diarrhea. Those are the 2 most important things to know. So if you know that they cause those, if you have a choice of gastroenteritis, diarrhea, right? Think about that, stomach upset. So you can kind of group them, right? That's the way I try and do this so that you guys can see it. But I did have to break it into 2 slides. Okay, so let's talk about salmonella for a minute. So salmonella, this is again now, this gets a little complicated, just bear with me. We talk about here on this slide, Salmonella typhi. Okay, so we have different, they call them serovars. Think about it as your COVID variants, your COVID mutations. These are different variations of Salmonella enterica, right? Those that cause that GI disturbance. So you have typhi and typhimurium. Okay, this guy here, the typhimurium, let's go back a little bit, is typhoid fever. Okay, and then there's typhi, I'm sorry, the other way around. So typhi is causes typhoid fever. This one has this in the name, but it's non-typhoid. Okay, they're probably not going to go into this level of detail. Okay, but just try and match this slide up a little bit with what we talked about on the previous slide with Salmonella typhi. That's the important one. This one. Okay, and then here, this one is the most common cause of food poisoning in the United States. Again, fecal, why am I having a brain fart here? Fecal water contamination, right? I was going to say fecal water contamination, no, that's wrong. Okay, Vibrio. Okay, here's another one, Vibrio cholera toxin, rice water stools. Okay, we had bloody diarrhea with mucus and pus of E. coli 0157. Now we've got rice water stools. Okay, this is like you are just pooping water. Your body gets dehydrated so fast that rapid dehydration can ultimately end up in death. Okay, you hear about things like cholera epidemics, again, in underdeveloped nations, you'll hear about it like, you know, India, Singapore, different areas where there isn't good sanitation, right? They're possibly drinking and eating contaminated foods, contaminated water. This guy here, Parahemolyticus, comes from uncooked seafood, sushi. Okay, causes gastroenteritis. Okay, usually self-limiting, but here's the thing that most people don't know. When you order sushi, anybody here like sushi? Okay, does anybody eat the ginger?
Mm-hmm.
Okay, who doesn't eat the ginger? Okay, eat the ginger. Okay, that's why Japanese people laugh at Americans when they eat sushi and they don't eat any of the ginger. Ginger is antibacterial. They put ginger on their raw fish to combat this. So get a little bit of ginger into you. Okay, we talked a little bit earlier, hospital-acquired infections, Campylobacter jejuni. We're talking about C. diff. Here's another one. Okay, fecal-oral route. Okay, usually in contaminated water and unpasteurized milk. Okay, most of us drink pasteurized milk. Okay, it causes bloody diarrhea with no pus. So you have bloody diarrhea with mucus and pus, you have rice water stools, and you have bloody diarrhea with no pus. Know your diarrheas, and then you know which bacteria it is. Okay, H. pylori, I probably shouldn't have to say too much about this. You guys should have had your clinical tests here about ulcers, stomach cancer. Okay, so we talked about colon cancer earlier, strep bovis, colon cancer, only answer. Here, if anything is mentioned on there about stomach cancer, the only answer is H. pylori. Okay, I know things have changed, they've probably changed some of these treatments, but the classic treatment was 3 different antibiotics and bismuth salts. Okay, and then here's just a little blurb on the bottom of the public health thing. Okay, the bacteroids. Okay, so we have a few of these. Again, a little less important overall. Bacteroides fragilis makes up 99% of our normal intestinal flora. And as a result, it can be involved in over 90% of peritonitis, peritoneal infections. It can cause infection when it gets displaced into the bloodstream during a surgery, during a trauma. Okay, and then these guys, just to keep the group complete, I put them on here. This guy now has a new name, so I gave it to you. Normal flora again. Okay, here's another tooth guy. Okay, so go back to your teeth, right? You have mutans, mitis, intermedius, you have the ones in root canals, you have the ones in cavities. This is also one that plays a major role in tooth and gum disease. Okay, and for some reason, this is just like a little clinical pearl, prevalence is high in the dental plaques of Down syndrome patients. I don't know why, I don't care, just know that you've seen it. Okay, and then this guy is fusobacteria. I don't know, they didn't teach me this one in school. I just put it on here again because it's another one that causes periodontal disease. There's a reason that is isolated from people with periodontal disease. Okay, a little bit more here about these guys, and then we'll do a slide on diarrhea. Shigella, remember, causes fever. E. coli and Vibrio cholera, no fever. Okay, but E. coli may produce a fever in children because of the immaturity of their immune system. Shigella and Salmonella, I stressed that on the previous slide, are never considered normal flora. Okay, the 3 most common causes of diarrhea in adults: C. jejuni, E. coli, that's that traveler's diarrhea. Okay, rotavirus, we'll talk about the viruses a little bit later. That's a viral cause in this list. Okay, and then rotavirus is the most common cause of diarrhea in children under 5. So let's talk a little bit about diarrhea. Let's pull this together again now. So watery diarrhea without systemic symptoms, E. coli and Vibrio cholera. Specifically, this Okay, diarrhea with blood and pus, invasive E. coli, Shigella, and Salmonella. Diarrhea with blood and pus and systemic symptoms, okay, fever, fatigue, Salmonella typhi, Yersinia enteropolitica, and Campylobacter jejuni. This is just one of those slides that you guys should just know. This is a memory slide. Okay, let's talk about hospital-acquired gram-negatives. Okay, the Pseudomonads and Acinetobacter. Okay, this one isn't too bad. One slide for this group. Pseudomonas aeruginosa. Okay, this is what happens in the lab. It fluoresces on a lab medium, where you can actually view it under a black light. Okay, this guy, if you isolate it in the lab, it smells like Welch's grape juice. You know, or if you've ever been in a winery, right, where they're processing grapes, that's kind of what it smells like. Kind of like I've smelled it in the lab. So when I also drink a lot of wine. So when I've gone on my wine trips and I go in, like especially upstate New York, I'm like, I go in and I have that, I'm like, oh, that smells like Pseudomonas. I just can't do it. And I've actually had to walk out when the processing room was a little too close to the tasting room because it's just mental for me. These guys, again, you got to think about this: immunocompromised patients. Okay, cystic fibrosis patients harbor some of these things in their lungs. Okay, both of these two, Pseudomonas aeruginosa, Burkholderia patient. Burkholderia used to be called Pseudomonas, so if you see it as Pseudomonas, it hasn't caught up with testing yet. CF patients. Anybody know anybody with cystic fibrosis? Okay, I have two cousins. They're both deceased now. They lived into their early 30s. One had a lung transplant, got another couple of years. When we went to visit them in the hospital, you can't bring flowers because flowers are in water. These guys grow in water, right? So that water around a plant or around flowers, when it starts to get stale and that gross kind of smell and everything, Pseudomonas can grow in there. If it gets aerosolized and it gets into their lungs, not that they're not already probably colonized with a lot of these in their lungs, it can be really fatal. So you'll see, like, if you ever see or know anybody that has CF, you can't, if you send flowers, they're not bringing them in the room. Or if you bring flowers, they stay at the nurse's station. Cannot go into the hospital. And some other places, okay, open wounds, burn wounds, UTI, pyelonephritis, right? What's pyelonephritis? Talk about our ascending and descending infections, right, in the urinary tract. Go back and take a look at that from a clinical standpoint. Can also be associated, again, because of the moisture in the fluid, with corneal infections, putting in dirty lenses, okay, lenses that haven't been either sanitized properly or have been laying out for a while. And these guys, I don't really care about. They're on your slide. Just, again, really, you've seen them. These are the two that you need to know. Okay. Haemophilus, Bordetella, and Legionella. Okay, so now we're still in gram-negative bacilli, gram-negative rods. These guys have really short rods, almost so short that they look like cocci. Okay, but the only gram-negative cocci is the Syrian. Okay, so let's take a look at these guys. Okay, Haemophilus influenza, type B. They call it HIV. This is bacterial influenza. Respiratory transmission, person to person. Okay, can cause meningitis, can cause inflammation in your epiglottis and the back of your throat, and it can result in sepsis. Okay, then this is my favorite one, Haemophilus ducreyi. It's also called chancroid. Okay, this is the way you remember it. I'm going to tell you why. Oh, he do cry. He has a chancre on his wanker. Okay? Because your differential diagnosis here for your test answers is with syphilis. The chancre of syphilis is not painful. In syphilis, it's called a chancre. In H. ducreyi, it's called chancroid, and it's wickedly painful. And usually also, another diff die on this is that syphilis, you can have multiple lesions, often do. Here, it's usually a single ulcer, and it's typically only unilaterally swollen in lymph nodes, in your inguinal lymph nodes. And this is one of my favorite ones. I love this. I was telling this to my mother last night. She's like, "You're not gonna say that to them." I'm like, "Yeah, yeah." Gardnerella vaginalis. Okay, this is a bacterial vaginitis, obviously in women. Okay, usually as a result of a disruption in normal flora, can be from antibiotic use. Right, you take some antibiotics, you disrupt the normal flora. You can result with yeast infections and things like that if you're a female, particularly. And this one, its characteristic here is really this, it's itchy, burning, but also the fishy odor. Bordetella pertussis. You have a little bit on here about immunology, so we have to talk about some of the serological tests. The way that you diagnose this is by the ELISA test, enzyme-linked immunosorbent assay. Okay, it's airborne. It's spread by aerosolized droplets. And what is it? It's whooping cough. Okay? Symptoms are similar to the common cold, but it has that characteristic, like you're trying to, like, you have to cough, but it's non-productive. We do still see some pockets of whooping cough these days. Okay, and there are times when we'll see it. Actually, as a matter of fact, when we get to Legionnaire's disease, there was just recently a Legionnaire's outbreak somewhere in the Bronx. Okay, it's almost like every year. That's the one. Legionnaire's disease is wet air conditioning units. Remember that? Droplets from air handling units. Okay, so we'll go back there too. Actually, am I there? Legionella pneumophila. Okay, Legionnaire's disease. This is the next one. I didn't even know if it was on the next slide. Okay. There are two things that are caused by Legionella pneumophila. One of them is called Pontiac fever, okay, which is like an acute influenza, acute flu, and then Legionnaire's disease, which is high fever and severe pneumonia. That's the one from the leaky air conditioning units. They say anything about that on the test, the only answer is Legionnaire's disease, Legionella pneumophila. Okay. So earlier on, I talked about Yersinia pestis, so now we're into the zoonotic diseases, okay? We're still gram-negative. Lots of gram-negatives, not as many gram-positives that are pathogenic to humans. A lot of that has to do with the endotoxin, the cell lysis and the release of that endotoxin, because gram-negatives have endotoxins. Yersinia pestis, okay? Also called the bubonic plague, also called the Black Death. Here's a cute one. Also called the plague of Justinian. So if boards really wants to screw with you, that's what they're going to use. Okay? These ones now, we're talking about reservoirs and vectors. Okay, so it's a rat reservoir and a flea vector. Okay, so you get a flea bite. Okay, in the southwestern United States, the reservoir is the prairie dog or the squirrel. Okay, but understand that there's a reservoir and a vector. These are zoonotic diseases. Okay, you get tender lymph nodes. They're also called buboes, specific to Yersinia pestis. Buboes, obviously bubonic plague. Okay, fever, headache, chills. You can get hemorrhages under the skin, skin ulcers. Okay, the skin ulcer here is absent. I did. Then this one, Francisella tularensis. It's also called tularemia. It's also called rabbit fever. This one is a rabbit reservoir with a tick or a deer fly vector. It's very similar to the bubonic plague, but this is the one that you do have the skin ulcer with. Okay, which is a well-defined hole in the skin with a black base. Now you go back and you start thinking, okay, I remember hearing that before. What else has a black base? Where is that black S-car? Right, that we talked about in the beginning. This is the way I want you to go through these notes and think about it. Group them, categorize them, and you guys are going to kick ass on this test. This one, there's in that book, Clinical Microbiology Made Ridiculously Simple. The way I always remember this, there was a picture in the book, and it was like, this is Francis the rabbit. He has a deer fly in one ear and a tick in the other. He, like, draw this little picture. So it kind of gives you the whole picture, rabbit fever. Francisella, Francis is the rabbit. Okay, then there's the brucella species. Okay, this is also known as brucellosis or undulant fever. Okay, humans acquire it from infected meat and milk. Okay, and it's also, you think about like meat packing plants, a vet, okay, somebody working on a farm. This one causes fluctuating, inconstant fevers, chills, sweats, weakness, all those things that go along with fevers, anemia. Okay, so you start to see, if there are blood tests drawn, you start to see anemia in the blood results. Muscle pain, swollen lymph nodes, lymphadenopathy. Okay, and then there's Pasteurella multicida. This is the one from a cat or a dog bite, because this bacteria is basically typical normal flora in cats and dogs in their mouths. Just like mutans, intermedius, salivarius, and the streps are with us. Okay, it can cause cellulitis, right? They're gonna bite you. Okay, they're gonna introduce that into the skin, and you can result in a cellulitis infection, leg, arm, whatever. Respiratory symptoms, and again, lymphadenopathy. Okay, so just these guys are, just know that they're the zoonotic diseases. All of them have what? For the most part, fever. Okay, undulant fever, rabbit fever. Okay, this one also, you have a fever with the the bubonic plague. Look in these slides for the commonalities. Okay, and focus on that. All right, chlamydia rickettsia, and some other guys. All right, so now we're back, we're talking about sexually transmitted diseases. We talked about gonorrhea. Gonorrhea is number 2, chlamydia is number 1. Chlamydia trachomatis causes several diseases or conditions. Okay, inflammation in the urethra. Okay, you can have a discharge here as well. Okay, just like you have with gonorrhea. Pelvic inflammatory disease, this is that whole thing, pus in there, right? It affects everything, ovaries, uterus, fallopian tubes. Inflammation in the cervix, okay, the infection can migrate to the uterus. That's how it gets to all of the sex organs. Can cause infertility, ectopic pregnancy, chronic pelvic pain. Okay, chronic pelvic pain, this one's interesting. I added this a few years ago. I don't know why it's called this. It's called the chandelier sign. Okay, so just associate this with pelvic inflammatory disease, if you see that on the test. Okay, in men, epididymitis. Okay, and then this lymphogranuloma venereum. This is a painless papule on the genitals. It heals over time, but the bacteria can migrate to the local lymph nodes. Okay, so you still can be infected with it. Okay, so trachoma. What does this mean? Chlamydia trachomatis. Trachoma is a type of conjunctivitis. Okay, chlamydia trachomatis, the trachoma from this bacteria, is the leading cause of preventable blindness in the world. Again, ask from mom to baby during birth. That's why we get that treatment, that antibiotic ointment treatment or drops when the baby is born. Okay? And also can result, it actually can cause also pneumonia. Okay, so there's some other complications with chlamydia. Reiter's syndrome. Did you guys learn Reiter's syndrome? Can't see, can't pee, can't dance. You know that one? Okay. That's an inflammatory arthritis of the large joints. It's usually conjunctivitis, right? That's the can't see, the can't pee is the swollen urethra and that inflammation, and then the can't dance is the arthritis of the large joints. More commonly occurs in men between 20 to 40 years old. And then Fitzhugh-Curtis syndrome, I gave you this one again, just so you've seen it. We talked about the liver, right, with women with gonorrhea. Okay, Fitzhugh-Curtis syndrome also can be caused by chlamydia, and it's a liver infection. Okay, then we get into a different species. Okay, Chlamydia psittaci, cause of psittacosis. Okay, this is also known as parrot fever. This you inhale. It's inhalation from bird droppings, from feathers. Can be if the bird bites you, right? They bite your mouth, yep.
Sorry, the fever syndrome, is that only in women or is that in children?
It's typically in women. It's typically in women. I wouldn't, to answer your question, I don't know exactly, but I think the predominant is something like 80 to 90% is it's seen in women. You're welcome. Okay, and then chlamydia pneumonia. Okay, is a form of community-acquired pneumonia, fever, headache, dry cough without yellow sputum, usually a normal lung exam, almost like a blind or a silent pneumonia. Patches or streaks that infiltrate on X-ray. You guys all had Dr. Matt, right? So you've talked about all of these things. You've talked about when we get to tuberculosis, the Gone focus, right? The Reinke complex. Okay, you're going to see some of that. You know, that's the one part where with this test, you can't look at any one of these 6 tests in isolation, right? And that's why you learn all this through the first few years of your clinical education here, because you can make linkages. Okay? Not always, but for the most part, you can. All right, let's talk about rickettsia. Again, I'm just reinforcing, we're still talking about gram-negatives. Okay, so rickettsia causes Rocky Mountain spotted fever. Okay, again, reservoir and vector, ticks, or an arthropod vector. Arthropods are other like lice, mites, ticks, things like that. Now, here's the important part, and this is one I want you to remember because we're going to talk about this again in a few minutes. Conjunctivitis, severe headache, and a rash on the soles of the feet and the palms of the hands. Okay, rickettsia. Then there's rickettsia acari, which is the disease manifestation is called rickettsiopox. This one again is a mice and an arthropod reservoir and vector. These guys, these last few I grouped because basically the symptoms are all the same. Okay, so based on the fact that I did that, the most important one, right, is rickettsia. That's the one you need to know. Prozekii and typhi. Okay, don't get confused here between rickettsia typhi and salmonella typhi. Okay, Prozekii causes epidemic typhus. Typhi causes endemic typhus, and guess what? Each one of those have other names. Rosenzer disease and Murine typhus. And then my favorite thing in the world to say is rickettsia susumushi, because that just sounds so much fun. That causes scrub typhus. Okay, all of them, the symptoms are basically the same. Fever, cough, rash, chills, muscle aches. Okay, and then here I just gave you a note. So with this one, again, they were recently looking at changing the genus from rickettsia to aurencia. It still fits in the same category, it just gives it a different name. Okay, Bartonella. There's 2 here. Trench fever and cat scratch fever. So Bartonella quintana is also known as trench fever, okay, due to lice bites. Okay, symptoms, fever, rash, headache, and this is one that you really should put a big asterisk on. If you see anything on your test that says pain in the shins, don't ask me why. The only answer is trench fever. Okay, has incubation period, 5 to 20 days, and then there's usually an interval between episodes of fever, like fever on and off. Bartonella henselae is cat scratch fever. Okay, from the scratch or bite of, guess what, a cat. Okay, it causes a low-grade fever, fatigue, swollen lymph nodes, usually swollen lymph nodes right near the site of the bite or the scratch. Okay, and then again, there's just a little note there on the bottom. Coxiella, still gram-negatives. Okay, Coxiella burnettii or Q fever. This is the only rickettsial disease that causes pneumonia and which there is no rash, as opposed to rickettsia, rash on the soles of the feet and the palms of the hands. Okay, these are 2 that they're going to ask you to know the difference between. usually contracted from contact with milk, urine, feces, or body fluids from infected animals. Rarely is this disease tick-borne. Okay, so that's what makes it also a little different from the ones that we've just done where there's a vector. Okay, the lice, the mice, the arthropods, etc. Overall, it's fairly uncommon. You're not going to have somebody come to you that's like, oh, I had Q fever. Okay, the most common manifestation is flu-like symptoms and mild pneumonia. They like this one for some reason. I know boards always love this one. They always ask about Q fever. Ehrlichia. Okay, so now we're getting into this whole thing, right, with Lyme disease, West Nile disease, Babesia, right? All of these tick-borne diseases that we're seeing. So Ehrlichia chafiensis causes what they call human monocytic ehrlichiosis. I gave you the other ones here. Know that you've seen them. They're probably not going to ask. That's probably not going to be the answer on the test. Okay, notice here the vector is the same. Okay, now this one also, Ehrlichia chafiensis, is similar to Rocky Mountain spotted fever, but there is again this one, no rash. Okay, they all cause high fevers, headaches, fatigue, muscle aches, GI symptoms, cough, blah, 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 right? But when you think about some of the tick-borne diseases, because of how they infect you and how they get into your bloodstream, there's often mental, like cognitive changes if left untreated. Okay, there are people, I have a Lyme story I'll tell you in a short bit. I gave you some examples of the ticks. Okay, that are known to be associated with Ehrlichia infections. And then this one I wanted to talk about specifically because before we get into Lyme and the spirochetes and all that, we're still in bacteria, these are bacterial causes. Have you guys learned about the Herx reaction? Okay. I guarantee that at some point in your careers, you're going to have somebody that you treat for chiropractic, for nutrition, for whatever else, that has or has had Lyme, that may even be suffering with chronic Lyme, okay? So typically what happens, this one, the Herx reaction, they always categorize historically with syphilis, with the treatment of syphilis with penicillin. But ultimately, if you think about your white blood cells, right, you think about what spikes in different types of infections, like typically you're going to have neutrophils spike with a bacterial infection. When you start antibiotics, okay, and this is also very much syphilis, but also very much associated with Lyme, there's often an initial worsening of symptoms. So you're hitting these guys with antibiotics, and they're going, yeah, right? And they're going to fight. So they're going to fight to stay alive. So you start taking antibiotics, and initially you feel shittier for a couple of days, right? Until everything kind of normalizes to some level of homeostasis in the body where you can start killing that bacteria or starting to knock back those spirochetes. Okay, so I've had patients come in. I did have a patient that has chronic Lyme. She came in and she's like, I feel like shit, I'm herxing again. And I was like, what? I'm like, nobody ever taught me about that. So this is more clinical for you guys to take forward with you. And you will see this, and you will hear this from patients. All right, spirochetes. Still gram-negative, okay? Syphilis, okay? So there's 3 genera, Treponema, Borrelia, and Leptospira. These guys are gram-negative, but because they're spirochetes, we talked about this in the beginning, the spiral-shaped bacterial morphology, these guys can only be viewed with dark field microscopy because the spirochete has different components, different makeup of its cell wall, of its cell membrane. You can't pick up that gram stain. So that's one that this is one that you have to do additional, immunological testing to determine. Okay, so Treponema pallidum, syphilis. The treatment is penicillin. Okay, there are several stages of a syphilis infection. That first stage, the prime is the painless hard chancre. Highly infectious. as opposed to Haemophilus ducreyi, right, which has a painful, soft shank. Okay, those are your differentiations. Secondary syphilis is like a bacteremic stage. So this one you can have a rash on your palms and soles of your feet, similar to rickettsia or rickettsia. Okay, you can also have a rash in the oral cavity. Condyloma latum, that's that wart, right? That like warty genital warts. Can result in the secondary stage central nervous system symptoms, can affect your eyes, your vision, okay, achy bones, problems with your kidneys and achy joints, okay, and then when it becomes systemic, you start seeing fevers and weight loss, and then again, lymphadenopathy. Okay, so now you go through your primary and your secondary stages of syphilis, and you hit a latent period. You may never go back. But 25% of those people then relapse and revisit that secondary stage. Okay, and then again, completely non-treated, there are people that will progress to tertiary syphilis. Gummas are like, think about it like this, it's like really gross. You can actually, in the skin, it's almost like an animal bit you, it just took like a chunk of skin out. So it's this open, like volcano-like wound. Cardiovascular symptoms, okay, ascending aortic aneurysms, and then neurosyphilis, okay, this takes you back to Dr. Reef's class, right, tabes dorsalis, peripheral neuropathies, treponema pallidum, syphilis, we mentioned it early on, can penetrate the blood-brain barrier, okay, and as a result, can result in mental and cognitive difficulties such as dementia. Now, Pearl would have talked about the trigger point manual, Janet Travell and Simmons, and that Travell was JFK's personal physician, something like that, blah, blah, blah. Everybody thought JFK was like, you know, this healthy tan, you know, oh, he's the president, look at him, he's this powerful guy, and he's hot, and he looks healthy. Supposedly, he had syphilis. He suffered with chronic back pain. The bronze tan of his skin has been surmised that he actually had Addison's disease. Okay? Just little fun facts for your Jeopardy watching. Okay, syphilis, more on syphilis. Argyll-Robertson pupils. Okay, these are where you get a combination but no reaction, right? You're doing your eye tests. Okay, it's a highly specific sign of neurosyphilis. But you may also see it in patients that have diabetic neuropathies. This you may see in practice. Okay, remember congenital syphilis because treponema pallidum can cross the placental barrier, it also crosses the blood-brain barrier. Remember that. Mom can pass it to baby. Okay, now, diagnostic tests, I threw these on here because I know they do say some things about serological testing. VDRL is venereal disease research laboratory, large rapid plasma reagent. They will give you the letters, you don't need to know the words. Those are screening tests, but more specific testing is from the fetal treponemal antibodies, FTA, ABS, and TPMHA. No idea what that one stands for. Okay, but this, you may see something like this. Test about VDRL or RP. Torches, okay? So this is the torches organisms. These are the ones, here's your list. These are the organisms that can cross the blood-brain barrier. Toxoplasmosis, we haven't talked about yet. Rubella, cytomegalovirus, we haven't talked about yet. Herpes and HIV, and syphilis. So I threw it in here because the first one we get was syphilis. This is a good memory slide. Okay, let's talk about Borrelia. Keep watching this, I'll give you another 5 minutes soon. Okay, Borrelia burgdorferi, Lyme disease, the Ixodes tick. Okay, we should all know almost everything there is to know about Lyme disease at this point as well. Okay, several stages. Okay, stage 1, bullseye. bullseye rash. Stage 2, okay, this is where you could have multiple or spreading of the initial ECM, the initial bullseye. Neurologic symptoms, okay, meningitis, Bell's palsy, peripheral neuropathies. Okay, you can have cardiac abnormalities, migrating arthralgias. Okay, this is the one. Highlight, asterisk, big deal here. This is almost pathognomonic of all these tick-borne diseases, this migrating arthralgias, but always go to Lyme. Think about Lyme right away. You wake up one morning, you've been bitten by a tick, you don't know it. Maybe you didn't see the bullseye rash, maybe you got bitten in the tushy, you can't see that. Okay, you get up one morning, you're like, oh my God, my knee, I can't walk, right? Day or two later, knee feels pretty good. Next day you get up, and you're like, oh shit, the other knee hurts, right? Migrating arthralgias, okay? It goes from typically in large dependent joints, knees, ankles, things like that. Late stage 3, chronic arthritis, encephalopathy. This is where you start getting some of these mental things. Actually, my current boss has a son who's now, he's going to be 27. For the last 2.5 years, this young man has been through hell and has suffered like nobody's business. He has been to every freaking holistic, naturopathic, medical, Western medical doctor, all up and down the Eastern Seaboard. He has what they've come to the conclusion of is that he has chronic Lyme. There's no other reason for his issues. This young man has spent the last almost 3 years with a pretty significant, like debilitating level. Not, I wouldn't say like, I wouldn't say that he's like, on his deathbed, but a significant headache. Like this young man cannot function. He's been through antibiotics. He's actually now going through a protocol they approved him for where they're giving him infusions of IgG. He's had biofeedback. He's had MRIs. He's had, I can't even begin to tell you. When the headache gets so bad, his parents have to take him to the hospital and they inject him a tour, just so that this kid can live. I don't know what kind of life it is, right? He's really struggling, and there are no answers. The only thing they could go back and pinpoint is that this kid got bit with a tick somewhere along the line, and he's got chronic Lyme. Hoping now he's in a new protocol with like some Lyme group in Poughkeepsie, New York. He was going down to some group in Washington, D.C. every 6 weeks. They were sending medication up. His parents were pumping him full of, get a port, all 9 yards. This kid's life is destroyed. So Lyme, don't take it for granted. When you see it, when you suspect it. I even, long before this, I used to educate my patients, especially when I knew people were like campers or hikers, or they were out in their yards all the time, especially any place where you have, it's not really the deer you gotta worry about, it's the mice, right? The mice, the chipmunks, all those ones that are carrying the ticks around. Okay, so educate your patients on Lyme. Leptospira. So leptospirosis found all over the world. Okay, guess where? In pee-pee. The urine of dogs, rats, livestock, farm animals, etc. Okay, humans usually get it when they're swimming in a lake and they swallow water. Right, it happens to the best of us. Okay, symptoms can vary from very mild to severe. Okay, and then ultimately, if it's severe, you end up with jaundice. Okay, it's liver. Okay, it's called Weil's disease. Okay, so liver, kidney, and hemorrhaging. Okay, internally. Okay, let's talk about the acid-fast bacteria, and then we'll take another 5 minutes. Mycobacterium and mycoplasma. Mycobacteria, tuberculosis, and leprosy. Okay, are you going to see people that are lepers? Probably not. They're weakly gram-negative. Okay, this is just a little laboratory fact here. But the important thing here is the mycoplasma. Okay, mycoplasma have no cell wall. So they're neither gram-negative nor gram-positive. And they are the tiniest free-living organisms capable of self-replication. This was always something the boards loved, okay? So they might get something like that. Now, let's talk about tuberculosis, okay? TB's on the rise. TB is actually, by public health standards, considered a re-emerging disease. Okay, think about elderly, AIDS patients, the poor. It infects the lungs. I can still hear Dr. Maddie's very melodic, lulling, soft lullaby voice going caseating necrosis through the microphone. I can still bring the microphone in, but his whole like heart full of shit. Caseating necrosis. So again, not teaching. I don't care that you can elucidate anything on tuberculosis. What I want you to recognize looking at these slides is that if you see any of these terms on your test, the only answer is Mycobacterium tuberculosis. Okay, diagnosis by the PPD skin test, which is a type 4 hypersensitivity reaction. Okay, also chest x-ray, sputum analysis, and then they'll take the sputum, they'll do an acid-fast stain. I threw this on here because of that whole thing about immunological testing that, I didn't really know what boards was going to ask. So this is the assay that would be used for diagnostics for tuberculosis. Okay, again, if you see gon-focus or Reiki complex, it's only TB. That's that calcified tubercle that you see on an x-ray. Okay, and TB is one of the great imitators of cancer. Okay, because of the lung test, how you, like, what do I have? I have lung cancer. Oh my God, right? They start looking at x-rays and testing. When they get in here, then they know for sure when they do this assay that it's not cancer, that it's tuberculosis. Leprosy. Leprosy is also known as Hansen's disease. This one's near and dear to my heart because on my board exam, that's how they asked the question. They used Hansen's disease instead of leprosy. Okay, this involves the skin, the nerves, the eyes, testicles. This is what results because of its effect on collagen and on your skin. It almost it almost like melts your face. It's kind of like the way to think about it. So the bridge of your nose becomes flat and indented, which is that saddle nose deformity. They say leonine facies. So when I say that, what I want you to think of leprosy, think of Simba from The Lion King, right? It's basically that wide, flattening of the nose, if you think of a lion's face, okay? And the diagnostic there is the Lepperman skin test. Mycoplasma and ureaplasma, okay? Mycoplasma pneumonia, okay, causes a mild self-limiting, yeah.
What was your question on Hansen's disease?
No idea, but that's how they described it. They didn't say leprosy. They didn't give Mycobacterium leprae. It was probably something about. It was probably something where they were asking about, patient presents with leonine facies and a saddle nose deformity. What's the bacteria? Or what's the disease? And the answer was Hansen's disease. And none of us knew it because nobody had ever said that to us in class. We guessed, a lot of us guessed. I think we probably 50-50, we all guessed the right thing. Because it was, again, what's the one thing I haven't heard? That's got to be the answer. Right? Don't second guess yourselves either. Okay, when you guys go and take this test, believe me, between what you're getting today and even what you got from Tony Ross, you know a lot more than you think you do. Okay, the worst thing that you can do, we tell it to students all the time, I'm just as guilty as I know every single one of you are. How many of you have taken a test, gone back over it, changed your answers, changed it from the right answer to the wrong answer? Go with your gut. Okay? Mycoplasma pneumonia, mild self-limiting bronchitis, and pneumonia. Number one cause of bacterial bronchitis and pneumonia in teenagers and young adults. I had this when I was a kid. It was thought many years ago that this was a pneumonia of homeless people and derelicts and alcoholics, and I was like 5 years old, like, okay. So, I was in the hospital for 10 days. When you're a kid and you went to the hospital and you need oxygen, they put you in an oxygen tent, right? So there was like this big plastic bag over my head that was giving me oxygen because I was having trouble breathing. My lungs were so bathed in fluid that I couldn't get any air exchange. And it's antibiotic treatment and whatnot, but those were the supportive treatments. There were also the inhalation treatments to try and the mucolytics to try and break up some of that infection. And other than that, I was like, I had no fever. I woke up and I was like, couldn't breathe. A small percentage of people that have mycoplasma pneumonia develop something called Stevens-Johnson syndrome that has, it's like a skin reaction. Okay, again, just threw that on there. Ureaplasma ureolyticum causes another one, right? It can cause urethritis in men. Okay, it's found in pelvic inflammatory disease and can be transmitted during birth. This one kind of crosses the line a little bit, and it can be considered a sexually transmitted disease. Sexually transmitted bacteria, I should say. All right, 5 minutes. We got. Okay, so now we're going to talk about. Now we're done with bacteria. Woo! Okay, so now we're going to do some. Now we're going to talk about fungus. Okay, we've done sexually transmitted diseases. We've done poop. We've done urine. This is fabulous. Okay, so basics, okay? Just a definition slide. I'll let you guys look at that on your own. Okay, what I did here with the fungal infections, okay, to try and make things a little clearer for you, is I grouped superficial, cutaneous, subcutaneous, and systemic. Okay, makes more sense to me to learn it this way rather than just learning lists of fungal infections. Right, so superficial. Tinea or pityriasis versicolor. Okay, this is a hypo or hyperpigmented patch on the skin caused by the fungus Malassezia furfur. Okay, I actually had a patient that had this. She was from Turkey. She was, I don't know, I think she had traveled to Turkey. I don't know if she picked it up in Turkey right before her wedding, and she came in and she's like, look at this. And she had like all these like red and pink and clearly white patches of skin on her. And she went to the dermatologist. They appropriately diagnosed her and treated her. She's like, I'm going to be taking wedding pictures. Look at this. Okay, so weird things you do see. Okay, tinea nigra, down dark brown to black painless patches on, guess what? The soles of the feet and the palms of the hands, right? So go back through your notes, group those things. Okay, what causes rashes? And where is the rash caused? Okay, this one is from the fungus Exophyala wernickeyi. Okay, treatment for both, dandruff shampoo. Okay, typically containing selenium sulfide. Okay, now we go cutaneous. Okay, so now we're talking about skin, hair, and nails. The dermatophytoses. These ones tell you where they are. Okay, tinea corporis. Corpora, the body. Okay, it can be anywhere. Okay, it's actually called ringworm due to its appearance, but it's not caused by a worm. Okay, tinea cruris, jock itch, if you remember from anatomy and embryology, right? The crura, right, is one of your anatomical locations, the descent of the crura. That should tell you where it is, jock itch. Okay, tinea pedis, athlete's foot, tinea capitis, the cap, your scalp, and unguium, if you think about your radiology classes, the ungual tufts, right, then you know that that's in the nails. Okay, Candida albicans, also cutaneous fungal infection. This one you'll hear of referred to as thrush if it's in the mouth. It's typically diaper rash. It's the cause of diaper rash in babies. Candida vaginitis, okay, from disruption of your normal flora through antibiotic use if you're a woman, right? So a lot of women that are predisposed to or typically get yeast infections, when they take antibiotics, you'll see all the commercials now, Activia, right? Probiotic yogurts, or you can go buy actual probiotics in the health food store. When I'm on an antibiotic, I'm not taking any chances. Every antibiotic that goes in my mouth, I take a probiotic with it. Because let me tell you, guys, you don't understand. Once you get the itchy scratchies, it is not fun. Okay? The thrush in the mouth, that also, we see that in cancer patients, okay? People that are being hit, like for example, my mother, when she had sepsis and they were hitting her with every antibiotic known to man through IVs, disrupts the normal flora. She ended up with an oral thrush that went like all the way almost down the back of her throat. She couldn't eat. She was like living on pudding, okay? Now, Candida albicans in the mouth, you can scrape it, right? So you can remove it. It's like it almost eats up the top layer of your tissue. So if you scrape it, it becomes like a bloody, sore, awful mess. As opposed to something that doesn't scrape off in the mouth that's related to cancer. Does anybody know what that is? Got it, leukoplakia. Perfect. Okay, so now we're gonna go another level down, subcutaneous fungal infections. Okay, now we're piercing the skin. Sporothrix schenkii, the disease is called sporotrichosis. It's also known as rose handler's disease, and think about it, it's from the prick of a rose thorn or something that's breaking your skin, like you're gardening, right? And you have some decomposing plant matter, and you get some broken skin from that. The other one's a little less important, probably, Fonsaceae, Phyllophora, Cladosporium. Okay, the disease caused by these is known as chromoblastomycosis. These are funguses that are found in rotting wood, again, transmitted by puncture wounds. These guys are interesting only in that they cause a small, like, purple lesion on your skin, okay, where it heals over, where it starts to close up after you've been exposed. Over months to years, you can have additional lesions appear if it's untreated, okay, because it becomes almost like this warty lesion as it dries up. Okay, systemic, okay, histoplasmosis, coccidiomycosis, blastomycosis, all are required by an inhalation of spores, never transmitted from person to person. Okay, the majority of these infections with these funguses are asymptomatic. Some may cause symptoms like mild pneumonia. Okay, again, opportunistic in AIDS patients. And there's a couple here that we'll talk about in a minute or two. Let's talk a little bit about histoblasto and coccidiomycosis. Okay, these are the ones that you need to know based on where they're most commonly found. Okay, so histoplasmosis is endemic to the Ohio and Mississippi River valleys, present in bird and bat droppings. Okay, it's also known as cave or caver's disease. What are people that explore caves called? Spelunkers, right? So it could be called spelunker's lung. It's also called Darling's disease. This one has a ton of different names. Blastomycosis is endemic to the Mississippi and Ohio River valleys as well. This one is found in soil and rotting wood, okay, but this one is really, really, really rare. Okay, and coccidiomycosis, Coccidioides immitis, this is known as San Joaquin Valley fever, endemic to the southwestern United States, causes a mild pneumonia or opportunistic infection in AIDS patients. So these guys are inhalation diseases. Histoblasto and coccidioides, they can very much resemble tuberculosis. And remember, we talked about tuberculosis as a cancer imitator as well. So, like tuberculosis, their inhalation, the primary infection is in the lungs, so it's almost like a mild pneumonia. Okay, or they can be asymptomatic. Okay, and they disseminate through the bloodstream. You do a skin test similar to a PPD. Okay, but tuberculosis is not person-to-person transmission. Okay, fungus, fungi with spores, these aren't acid fast, this goes back to that laboratory thing, I won't worry too much about. Okay, Cryptococcus neoformans and Cryptococcus gattii. These are endemic to Papua New Guinea and Northern Australia. Okay, I threw this on here because it's a little bit newer, reported in 1999 in the Pacific Northwest. It's considered an emerging infectious disease. So this is here, some of your linkage again to public health. It's from pigeon droppings. Okay, and it can cause meningitis. And then we talked about our Candida albicans, so I'm going to pass over that. Aspergillus fumigatus. It causes 3 major types of human disease. The one that you have to be most concerned with is the aspergilloma. Okay, remember talking with Dr. Maddie about cavitations in the lungs and fungus ball? I think he covers this in pathology. So aspiration of aspergillus, of that fungus ball, basically causes like an asthmatic reaction, okay, which is a type 1 hypersensitivity reaction, asthma, and those types of type 1s mediated by IgE. So here's some of your linkage to immunology. This one produces a mycotoxin called aflatoxin that can cause liver damage and liver cancer. Okay, so we talked about colon cancer, stomach cancer, and now we have liver cancer. Typically contaminates peanuts, grains, and rice. Okay, and it can disseminate your bloodstream and cause widespread organ damage. Okay, so here, the most important things on this guy here are think about this term, right? The fungus ball, that aspergilloma, okay, and that your linkage to immunology, that it's IgE mediated, okay, and then this part about liver cancer. Okay, then we have some things that are bacteria that act like fungus. Okay, so it's a weird kind of place to put this, but it used to be all in the fungal category. So actinomycetes and nocardia, they're actually gram-positive bacteria, okay, that act like fungi. Actinomycetes israelii is the species that we talk about. They're water and soil saprophytes. Okay, they cause abscesses following trauma to the mucous membranes in the mouth and the GI tract. And then nocardia is from inhalation, grows in the lung and produces abscesses in the lung and cavitations. Okay, it's a slowly progressing pneumonia with cough, shortness of breath, fever. Okay, and it can also disseminate in the bloodstream. A lot of these fungal infections, that's what happens. If they're infecting your lungs, you're coughing them up, you're swallowing them back down, right? They're getting into your organs and into your bloodstream, and then they're just wildly going through your body. Yeast-like fungus. Okay, again, it's a fungus, but it behaves more like a yeast. This one is Pneumocystis jirovecii. This one was previously called under the protozoa category. So this guy could be in any category. I think because of that variability, it's probably not something they'll ask you about specifically, because it's been moved from category to category, from protozoa to yeast to fungus. All right, let's talk about viruses. Here we go. Okay, these guys are, here we're gonna have a lot of slides and a lot of lists. Point out things that I want you to remember for each one. So let's talk about this. Again, categorized quickly as those that cause respiratory problems, those that are digestive, those that are systemic with some sort of skin manifestation, those that are systemic in the blood, those that cause fevers, those that cause warts, those that cause central nervous system. You see how I group them? Okay, so that when you're looking at them and you have a list, you know what area of the body you're focusing on, where they're most prevalently affecting the human. Okay, so respiratory diseases. Guys, we know most of these, right? The adenovirus, okay, upper and lower respiratory tract infection. Look at this. Upper respiratory infection, upper respiratory infection, upper respiratory infection. Okay, the influenzas, right, what do they cause? Basically like that flu-like symptom, upper respiratory, lower respiratory. Okay, so that's where you're at, that's where you are, it's in this respiratory disease category. Okay, Coxsackie virus, it's kind of an interesting one, right? You know, it's actually, I think you say Coxsackie is how it's pronounced, it's upstate New York. This one causes something called pleurodynia, okay, which is pain in the intercostal muscles. It's also called devil's grip because the pain is so severe that when you start to cough, you're like you're trying to hold your rib cage from expanding because of the pain. Okay? It's also known here, and you can put an asterisk on this, as hand, foot, and mouth disease. Okay, influenzas. Influenza A, think pandemic. Okay, that's the bad one. Influenza B, we've probably almost all of us have had influenza B at some point. Okay, usually when we're kids and we acquire immunity to it. Okay, but this one, make sure that you know this. Okay, you've heard of Rise syndrome. Okay, usually it's from treating kids, which you shouldn't do with aspirin at a young age. Okay, so you can tie that one into influenza B and kids. RSV, respiratory syncytial virus. Almost every kid that goes to daycare at some point has respiratory syncytial virus. It runs rampant in nursery schools and daycares. Okay, it's the #1 cause of pneumonia in infants less than 6 months of age. Okay, typically winter and spring outbreaks. Why? I don't know. Probably just, you know, the way the seasons fluctuate. It spreads easily by direct contact. Okay, this one can stay on the surface for a long time. Again, we talked earlier about sanitizing toys and things after kids leave daycare. This is another reason why. Okay, and the last one is roseola virus. Okay, this one's known as sixth disease. Okay, it's also called roseola infantum, and it causes a skin rash. Okay, also in that category there, I threw on human herpes virus 6 and 7. Okay, we move to digestive. These are all things that you probably have heard about. Okay, we talked a little bit earlier about norovirus and the Norwalk virus. That was my cruise ship story about people pooping in bags and throwing it over the side, right? Mumps. Okay, do we see this kind of stuff today? You know, my father had mumps. My mother had mumps when they were kids. They were kids in the 30s, right? We don't see this kind of stuff. Fever, myalgia, headache, fatigue. Here's what's pathognomonic here, right? Painful swelling of the salivary and parotid glands. In boys, orchitis. And rotavirus is the most common cause of childhood diarrhea. If we go way back to the beginning when we were talking about bacterial things and causes of diarrhea, rotavirus was on that list. Okay, Hep A and Hep B. Okay, Hep B, B for blood. Okay, you know how I love the B's, right? B for baby, strep agalactiae, group B strep. Right, this one is another B. B for blood for hepatitis. Okay, this is why the hospital workers are all vaccinated for hepatitis. And we'll move quickly through some of these. Okay, measles. Recent measles outbreak, 2019, 2020, in the Orthodox Jewish community in Rockland County. It was like huge. I forget how many cases there were, and you know, they were running around and saying, hey, you know, almost everybody else has been vaccinated, right? And they were trying to educate these folks to understand that they're going to spread this within their own communities. It's also known as rubeola. Okay, and here's some pathognomonic things here. 4 Ds, 4-day fever, and the 3 Cs, cough, coryza, and conjunctivitis associated with that. Now, the only place you're ever going to see anything, if they say Koplik spots, the only answer is measles. Okay, and this one, the rash spreads. Okay, spreads from top to bottom. Rubella is known as the German measles. Okay, this one's a very quick measles, it's known as the 3-day measles. This one spreads from the face to the trunk and the limbs, has a low fever, swollen glands, very similar, but the only one where you're gonna see the coptic spots here is with measles, classic measles. Parvo B19 is Fifth's disease. This one's a good one. You see this a lot with kids in daycare, okay? But interestingly enough, after the child has had it, is when the slapped cheek and the fever comes out. So by the time you can tell that a kid has B19 or parvovirus, they've already spread it to all the kids in their daycare class. Because you just thought, well, you know, they kind of had a cold, right? They had a cold, they had a cough, I sent them anyway. Okay, so this one, those symptoms begin 6 days after exposure. So they've been exposed, they have it, the symptoms show up, now they've exposed everybody else in their daycare. And I know people, I mean, I have friends with kids that have come home, yeah, you know, everybody's got Fifth's disease. Vaccinia, smallpox. Do we need to talk about smallpox and monkeypox and everything now? You see my question mark here. Smallpox? Yeah, smallpox has been eradicated in industrialized nations. I actually have a slide that surprised me that I had monkeypox mentioned on last year. Okay, but similar to that same kind of disease. Varicella zoster. Okay, the viral pathogen that causes chickenpox and shingles. How does shingles happen? Only people that have had chickenpox can get shingles. Because, why? The virus lies dormant after a chickenpox infection in dorsal root ganglion. That's why in that DRG, when you have shingles, it comes out in that dermatological pattern, right? So it's from that particular nerve root. Patients with shingles, you will see them. I had a patient that came into me once, loved this woman. She was heavy woman, big, heavy tushy, little thin on top, but she was trying to lose weight and she had taken up golf. She's like, you know, I like going to the golf course, I like going to the driving range. So she comes in and she's like, you know, I've been playing golf. She's like, my shoulder, my upper shoulder's killing me, and I just have this pain in my arm. And I'm like, all right. And she goes, oh, and while you're at it, would you mind? She said, I have this rash. She goes like this. She's like, here, I've been putting some cortisone on it. Can you see it? I think I have some of it on my back too. And I'm like, can you do me a favor? I'm gonna step out, put a gown on, I'll be right back. She come back in, I'm like, Edie, you have shingles. That's not just a rash. I'm like, it's here and it's around the back. And he's saying, I don't have shingles. I'm like, you need to, so actually what happened was I treated her first because there was nothing on the skin. Treated her, adjusted her. She called me the next day. She said, I feel so much better. My arm, my shoulder feels so much better. She's like, can I come in again on whatever day? And I'm like, yeah, sure. So I give her an appointment. And that's when she came in with the cream. And I'm like, you have shingles. You need to go to urgent care right now and get on Valtrex or something. She said, I don't have shingles. I'm like, we're calling your doctor right now. Made the appointment. When she calls me later, she's like, I have shingles. I'm like, no shit. Now, shingles, you can't give shingles to somebody. But if you have shingles and anyone who has not had the chickenpox comes in contact with your lesions, you can give them chickenpox. That makes sense? Herpes simplex 1 and herpes simplex 2. Where I remember this is 1 comes before 2, the mouth is higher than the genitals. That's how you know which one it is. Okay, systemic with hematopoietic disease. Cytomegalovirus, okay, viral pathogen there. It's also associated with human herpes virus 5. There are many human herpes viruses. Pathognomonic for this is this owl's eye occlusion. And this is very similar to mononucleosis. Okay? This one, however, can cause blindness. Okay, Epstein-Barr is infectious mononucleosis. Epstein-Barr syndrome can also be associated with people that have Burkitt's lymphoma. Burkitt's lymphoma also associated with HIV. And then HIV 1 and 2, AIDS and AIDS-related complex. Okay, these are the blood viruses. Ones that cause fevers. Okay, so you guys hear about some of these on occasion. Most of these are from mosquito bites. Okay, I'm not going to go into a lot of detail here. I'm going to let you look at this one on your own. Hey, here's the thing though. All types of viral hemorrhagic fevers are characterized by fever and bleeding disorders, and all can progress to a high fever, septic shock, and death. Okay, then we have ones that cause warts or that manifest as warty growth. HPV, we've heard a lot about this, right? And the immunizations. Okay, so condylomas are warts. Okay, HPV 16 and HPV 18 are associated with cervical cancer. There's another cancer, right? Put that on your cancer list, and which bacteria, viruses, etc. cause or are associated with. Molluscum contagiosum is also known as water warts. So these are like warts or raised lesions that are filled with fluid. Okay, these guys start thinking of like dirty towels. Okay, fomites. Anybody ever use that word with you before? That's why when you go to a gym, you know, common courtesy, aside from the fact that you're like a sweaty mess, when you're done, you get off a table or you get off a machine, you're supposed to wipe it, clean it. You know, it's part of sanitary practices, and I guess now in the gyms it's probably even more so after COVID. This one is also commonly seen with AIDS patients. Okay, and then the central nervous system. Okay, polio. Here we go. Right, polio is looking like we're seeing it again. Right, there's something like, I don't know how many hundreds of cases now they've said they've seen across the United States. They're testing wastewater, right, which is something we were never able to do before. We never did. We even tested wastewater during COVID to see, like they were testing, I think it was like some college in Arkansas or Alabama in 2020 realized that they could test the wastewater to see if COVID was present in their wastewater. And that was something that they were using to determine their red, yellow, green light, you know, exposure levels. They just found polio in wastewater in New York City. They found it in Rockland County and Orange County. Okay, again, not to point fingers, but unvaccinated populations of people, for whatever reason and whatever the resistance is, whether it's religious reasons or what. Those areas are typically populated by Hasidic Jews who travel frequently. Okay, they travel back to Israel. They can be exposed to folks in their travels, as we all could, but most of us are vaccinated against polio. If they're not, and even if they're exposed to people that have been vaccinated, there was an oral vaccine for polio that was never quite as effective. And those people can actually have or transmit the virus to people that haven't been vaccinated. So this is something now you're going to start seeing a lot of in the public health area and on the news. Rabies, okay? If you see negri bodies, the only thing it is rabies. That's all I need you to know about it. The JC virus, I put this on here. I've never heard, nobody has ever come back to me after one of these reviews saying they asked about the JC virus. Okay, again, it could be an answer choice though. And the arboviral encephalitis, okay, these are also known as Eastern or Western equine encephalitis. There's a couple other names for it over here. And this is where they can try and confuse you. So just make sure you understand you've seen this somewhere. Okay? And then don't forget some of these guys. Hantavirus, Ebola, right? Remember Ebola a couple of years ago? Okay, coronavirus. Back a couple of years ago, I was teaching about SARS-CoV, not about coronavirus per se, not about the COVID. Causes both upper and lower respiratory symptoms and gastrointestinal symptoms, also believed to cause a significant percentage of common cold in adults. There are many coronaviruses, okay, and bats in general harbor a ton of different viruses. It's just a matter of when they're going to show themselves that they've found a host. Okay, and then human herpes virus 8, also known to be isolated in Kaposi sarcoma. Kaposi sarcoma, you guys should know, is associated most often with HIV and AIDS patients, although it doesn't always have to be. I had a patient, I had two older gentlemen that were a couple for many years. They're in their 70s or so. I think it was actually for this one guy, Ed's 80th birthday. His dream was to take a cruise on the Queen Mary. So he and Joe took off on this like dream trip. And he wakes up one morning and he goes, we're on the ship. And he goes, the sheets at the bottom of the bed, there's like blood on them. He looks at his foot. He had a lesion on the bottom of his foot. And when they docked wherever they were in England, they went to the doctor, and the doctor looked at it. The doctor's like, yeah, when you get back to the US, you need to have this looked at. They were a gay couple. He was not HIV positive, nor was his partner, but the lesion was diagnosed as Kaposi sarcoma. So, you know, just so you know, there's always exceptions to the rule. Okay, this guy, I think he just recently passed away. I kind of keep like Google stalking tabs on my older patients, like ones that were really special to me. So like creepily, I Google like obituary to see if they're still alive. And this man actually lived to be 89. So typically, story is Kaposi sarcoma associated with AIDS or HIV. This particular individual, while he met the demographic of those criteria, he was not HIV positive, and he showed up with Kaposi sarcoma. All right, prions. Prions are something that are near and dear to my heart in a weird, creepy sort of way. Okay, here's another story. I'm going to let you guys look through most of this one on your own. You guys have heard about mad cow disease. You've heard about Creutzfeldt-Jakob disease. You probably learned a little bit about prions in your classes. These diseases are very rare. Okay, if you look at here, okay, CDC reports the incidence of CJD in the world occurs at a rate of 1 in 1 million people, okay, per year. It's like 300 cases, you know, it's small. I think in the US, it's 3 to 350 cases a year. These are things that you think you're never gonna see. My great aunt died of Creutzfeldt-Jakob disease, sporadic Creutzfeldt-Jakob in 1989, before the mad cow outbreak, before it was a thing, before anybody even knew what it was. We actually, when she passed, there was a group in Yale that was doing research on it, father and then daughter. So her body, because of the infectious nature of this prion particle, couldn't be embalmed because it would have put the funeral directors at risk. So we sent her body to Yale New Haven, to this group. They harvested brain and spinal tissue for their research and their analysis and sent her back. And it was closed casket, and that was the end of it. Even the EEG probes that they use for EEG analysis of the brain, those have to be destroyed. This prion particle can't even be killed with an autoclave. It's a progressive, pretty rapidly progressive muscle wasting, dementia. The way it started with my aunt was she called my father and she said, I won the lottery. She was checking her own numbers against her own numbers. And then she called them and said there were big rats in the sink in her house. And it was like, what the hell? So it's hallucinations, eventually like hearing and vision loss. It was awful. At the time, Fergie, Prince Andrew and Fergie, they were having their first baby. I forget which one it is. And they were talking on the news about how these, you know, in English, in the royal culture, they have like multiple godparents. So my aunt was in the hospital and, they had diagnosed it. She was in a red bag room, so we were gowned and everything. And she's like, "Oh my God, you're here." She goes, "So glad you made it." And she was 80. And I'm like, what's going on, Aunt Louise? And she's like, "You see this? You see this on the news? I have to get out of here because I've been chosen as one of the godparents." So, you know, go through this. This is a public health thing, okay? The most important thing about prions, I did all my research. Every paper I ever had to write for a science class from that moment on was always on this. Do your research, do your reading on it, but this is the key. Prions contradict the central dogma of molecular biology. Okay, these do not need nucleic acid to replicate. They're proteins. They're proteins that are altered and they change their configuration from alpha helix to beta sheet. The beta sheet configuration of that protein particle is what confers its infectivity. No one knows where it comes from, no one knows why. It's usually, sometimes they say it can be kicked off by a trauma. It's usually in older people. You know, there's history that goes way back to Papua New Guinea, where they, the females in a tribe there, the Kru tribe, all ended up with this because the females honored their dead by eating their brains. So, you know, there's theories about people that have traveled widely and eat weird shit, you know, wherever they've gone, that, you know, maybe down the road that there's something that kicks off this conformational change in the protein. It's really, it's still a very interesting area of research. But then, of course, you know, where we all heard about it, where it became, you know, a thing, was with mad cow disease in the early 90s and 80s. So take a look at these. I put some public health data on there for you, just so that you understand its prevalence. Like this is deaths per 1 million in the US. And this I updated from your presentation. 2019 was the last one. I threw the 2020 on, so here's 2020. Yeah. But like, all right, a little over 500. I've now known my aunt and 2 other people that have died of this, which is bizarre considering how rare it is, right? This is just a little bit again about the mad cow outbreak. BSE, bovine spongiform encephalopathy, there were 26 cases identified in North America. The key there is that in North America, they were always from cows that were imported to the US. It wasn't that it started here. It was, you know, purchase of cattle from other countries. And there's a whole bunch of these spongiform encephalopathies that affect other animals. All right, parasitic infections. We're going to blow through these next few slides until we get to here. Okay, so we don't have much more to go. We're almost sort of on time here. And then I'll explain to you what I want you to do with the rest of the presentation. Okay, so parasitic infections. Okay. These are typically diseases in the tropics and temperate zones. Think about malaria, right? Malaria causes the most deaths globally. Any place in this presentation where you see tiniest, smallest, largest, greatest, most, right? Those are where you want to kind of focus your energies. So know about malaria. There are a classification of neglected tropical diseases. I gave you a whole bunch of them here. In developed countries, including the United States, so here's your bolded statement. Trichomoniasis is the most common parasitic infection in the United States. What else have you heard of? You've heard of Giardia, right? Giardia lamblia. Hopefully, Tony Ross or somebody taught you about Giardia, okay? But also Cryptosporidium. Cryptosporidosis is the most frequent cause of recreational waterborne disease outbreaks in the United States, and then toxoplasmosis. Right, you guys know about these. I know he gave you. Okay, so go back over these and look at them again for parasitic. That's it. Those are the only ones I'm giving you for parasitic. Most important. Go back and take a look at those. Okay, now let's let's talk about the helminths or worms, or nematodes. Okay, this is a memory slide. Okay, if you're allowed to have a piece of scrap paper with you when you take the test, write this out, because I promise you these questions on worms, it will make it so much easier. We got to this at the end of the semester, and I'd look at this and I'd be like, who cares, right? Flatworms. Oh, flatworms, they're trematodes, but trematodes are also called flukes. And what's the difference between a cestode and a tapeworm? Well, they're the same thing, right? These are just more names for the same classification. So memorize this. There are two main groups. The two main groups are flatworms and roundworms. Of the flatworm category, there are two subclasses, trematodes and cestodes. Of course, trematodes can also be called flukes, and cestodes can also be called tapeworms. And then you get here, roundworms are called nematodes. Just write this out. Right? So if you get anything on this on the test, and they tell you this trematode or this whatever, then you can just automatically get your eye to it, okay, and know that you're dealing with flatworms. Because this can get very confusing. Okay, there's a third group, but we don't care about it. So the trematodes, okay, again, flatworms. These are the ones you need to know. Schistosoma, and then I'm not going to try and pronounce the next one. Clonorchis sinensis is the Chinese liver fluke. Paragonymous westermanii is the lung fluke. Okay, we'll talk a little bit about the life cycle requirement and the vector. Okay, and then symptoms and disease is probably not the right heading there. This one causes swimmer's itch. It's also associated with something called Katayama fever. This one is inflammation in the bile ducts and gallbladder and GI symptoms. This one is mainly pulmonary. So if you look at this, this is more on the skin. This is more internal to the GI, and this is more internal to the pulmonary system. Right? And I gave you the types, but I didn't give you the names there. That doesn't matter. As long as you know schistosoma species, you'll be fine. Okay, now the cestodes. Okay, these guys, Tenia saginata, definitely know this one. It's the largest tapeworm. Hymenolopsis nana, know this one. It's the smallest tapeworm. Okay, now, in the rest of this list, take a look at this. These are all basically related to GI symptoms and or to the eating of a particular type of meat. Okay, these slides should be pretty easy for you to just go over and kind of commit to them. Okay, the only difference here is this last one, a small number of cases can lead to B12 deficiency. Okay, B12, intrinsic factor, GI, right? You're still in that same ballpark here with GI. Okay, intestinal nematodes. Okay, so now we're looking at other ones. Trichuria is a roundworm, which is commonly known as whipworm. Okay, let's confuse this even more. It's known as whipworm, referring to its shape and the way its motility is granted. It's like a whip in it. Okay. Ascaris lumbricoides is the largest and most common parasitic worm in humans. Okay, an asterisk on this guy. Okay, Enterobius formicularis is also known as a pinworm or a threadworm. Okay, you see why I said to take that first slide and kind of get that in one place? Because nothing on that list in the beginning for classification is a pinworm or a threadworm. See what I'm saying? This is why this section I always found was very, very difficult. Spend a little time on it and memorize that first slide so you know where to classify things. This one is interesting, the close contact Scotch tape test, right? So my friend Melina, the crazy one with the tissue box, when she had her first kid, because she's such a clean freak, she was way ahead of her time. She had a thing of Purell on her keychain long before COVID. Like, This girl, if you have pretzels in a container at a party, she picks it up, she eats the pretzel, and the part that she touched her fingers with, she puts on the edge of the plate, and that goes in the garbage. She's a freak. I love her dearly. She's a freak. When she had her son, because I knew she was a freak, I was like, oh my God, like, guess what I just learned in school? I'm like, what are you gonna do when Freddie's out playing in the dirt? And she's like, well, what do you mean? She goes, I'm gonna bring him in and give him a bath. And I'm like, oh my God, Melina, you have no idea all the things that he can pick up in the dirt. I go, there's actually this thing where you can get a worm disease and the worms crawl out of his hiney at night. She was like, I thought we were gonna have to peel her off the ceiling. And I'm like, but it's okay, because all you do is spread his cheeks at night and put a little Scotch tape there and see if you... She was flipping out. But this is what it was. This is what, so then, of course, I took a picture of it out of the clinical book and sent it to her email because I'm that much of an asshole. But that's the Scotch tape test is most often associated with enteroplasmic folliculitis. Okay. These are interesting. What I want you to know from here is which ones you get by ingesting material and which ones you get from skin penetration. Okay. So the only real wild card here is anklostoma duodenale because it can be from ingestion or from skin penetration. Okay? Tissue nematodes. Okay? Here's a whole bunch more. These guys from bites. Okay? Except for the wild card. There's always a wild card on every slide. There isn't a lot to know about these. Okay, that's why the slides are kind of light. Okay, it's a matter of you knowing. Ah! I told them, I said, when I found out you were coming, I said, I'm going to cry. All right, Robbie. Good, hanging in, almost finishing up. We're cranking through, Evan.
Yeah, I heard she's not doing great.
Yeah. I had to tell her like 10 times where I was coming today. She probably still doesn't know where I am right now. It's like long hair. What, you grown out a mullet? Yeah, hippie?
I'm trying.
You're like a surfer boy with the hippie hair and everything.
All right, I'll let you finish.
You're still a sex maniac. You're still the hottest thing I ever saw. But again, there really isn't a lot on here, right? It's just know the groupings. Okay, be able to know that these guys, if you see any of these guys in any of your questions about bacteria, they're wrong, right? These are about the worms and the helminths. Protozoa, okay, same thing. These are probably our last 3-ish slides, okay? Again, broken into several categories. Which ones are intestinal? Which ones are typically in the bloodstream? Which ones are typically intracellular, okay? So, luminal, intestinal. Entamoeba histolytica, okay, these are ones where you're swallowing the cysts, okay? You guys remember there's this whole thing about trophozoite, parazoite, blah, blah, blah. Did they talk about any of the life cycles of any of these things with you? Okay, I want you to remember one thing. Unless the question is about malaria, the answer is always trophozoite. If the question is about malaria, the answer is merazoite. It's the only thing you need to know about life cycles of any of this shit. Okay? That would get you through any of those questions. So again, crank through this list. Okay? Cysts are swallowed. Enters the nose when swimming and diving in fresh water. Okay? So ultimately, swallowed, right? Ingestion of untreated sewage, because that sounds like we all want to go out and have lunch. Okay, the only one, the wild card on the slide here now, is Trichomonas vaginalis. Skin to skin contact via vaginal intercourse. Okay, and then take a look at this. This was that brain eating amoeba, this one, Naegleria fowleri. Remember I mentioned at the very beginning of the presentation where that was on the slide, and we'll get to this later. This one causes an encephalitis. Goes in through the nasal mucosa, and the girl actually died. Okay, so there are some of these things that you do see. In the bloodstream, okay, here's where we get to malaria. This is the most important one, Plasmodium falciparum, okay? malignant tertian malaria from the female Anopheles mosquito, release of merozoites. Everything else, if it asks you a question, pick trophozoite. And I put pictures on here because I always talked about this when we got to this one for Babesia, the Maltese cross. So people were like, well, what's a Maltese cross? The fire cross that you see, fire departments, that's a variation on the Maltese cross. So if you think about that like a red blood cell, or this is a classic Maltese cross, that's what happens to the red blood cells when you have Babesia. They kind of pinch in and create something that looks like that when you look at it under a microscope. Okay, these are tick bites, right? Mosquito bite. And then another one of my favorites, Trypanosoma brucei, African sleeping sickness from the bite of the tsetse frog. This one crosses the blood-brain barrier. Okay, here's your difference between malaria and Babesia. Malaria does not infect the liver cells. Babesia does, although they look very similar. Okay, intracellular, Trypanosoma brucei, also known as Chagas disease, from the red vid bug, okay, otherwise known as the kissing bug. These have nervous system manifestations. These two guys in the middle, the leishmanias, are skin manifestations. And toxoplasmosis gondii, we talked about this, or we didn't talk about this, we talked about the females eating soft cheeses, but another thing for pregnant women is caution around cleaning out cat litter boxes, right? Because of this, and again, because if you're infected with it, it can cross the placenta. Okay. Oh, I missed my heading here. Okay, so here's my little thing about that lifestyle. This is what I was telling you. Okay, this is all you need to know. A little bit of a description on what they are. Okay, but unless it's malaria, always pick trophozoite. Okay, now, what I have here, I'm going to tell you what's here, and I'm going to let you do these two sections on your own. You guys probably got more public health than I did. It's a long story behind that. We didn't have a public health teacher until 3.5 weeks into the semester in which we were taking the board exam. The teacher showed up the week on Monday. We were taking boards on Saturday. I told them, come in on Wednesday, give us everything we need to know in basic form. And then I went into Dr. Zali's office and I said, attendance requirements be damned. You didn't have a teacher for us for the subject that we just took an exam on. We now have a study hall and no one's getting penalized for attendance. Zali's loved me. So you guys probably got more public health than I did, but when you go through this, it's very basic. You know, these are the agencies that you need to know about. A lot of it is definitions. Public health, when you think about it, a lot of it is common sense, right? Clean water, nice place to live, adequate food, all those things that prevent you from becoming immunocompromised in some way. You probably did a little bit about your type 1 and type 2 error with Dr. Pearl. I'm not going to go into that. Again, definitions, sensitivity versus specificity, screening versus confirmatory tests. We talked about when we were looking at syphilis, right? The VDRL and the RPR are screening tests. And those other two tests, the fetal treponemal antibodies, those are specific tests. Okay, what's population health? Okay, I gave you a little link here for a website. Take a look, do a little reading on that for some background. What's a population health assessment? Okay, this is all your public health stuff. Here's your health reporting. Okay, these are the things like, oh my God, polio showed up in Rockland County. What happened? Right? Reporter, the local person who identified it, notifying the local agencies, notifying the state, notifying the CDC, and ultimately the World Health Organization. That's the order. Control of communicable disease. Think about it. It's just what we just talked about, right? Most common causes of death in emergencies and disasters. Here's your list. Okay, how do you control it? Clean water, place to live, vector control, etc. Immunization. right? Gotta put it on the list. Okay, so I'm gonna let you go through this, the rest of this on your own. We're just gonna flip through, okay? Know your mechanisms of emergence and reemergence. Here's just a little blurb from 2020, top infectious disease stories, the first one on the list. Shouldn't have to talk about that one anymore. And interestingly enough, look at Mary Freeley was ahead of her time. Look at the last one on the list, monkeypox. Okay, what are some emerging infectious diseases? What are some emerging tick-borne diseases? Okay, but when it comes to the public health section, unless they're asking you about wastewater treatment, sedimentation, flocculation, all of that, it's common sense. Go with your gut and make sense of the question. Okay, think about all the things that can fall. Think about what's happened to us in the last couple of years, right? How these things emerged, how they traveled. And then, as I turn it over to Dr. Hughes, who's probably going to talk about immunology. This is my shtick. You can tell Rose Gallagher that I said this. I hated immunology. I hated every bit of it. It was the worst thing in the world for me. I struggled with it. I went through and I created this little primer because it used to be very much embedded in microbiology, and I think it's now in the pathology. It's everywhere actually. Right? So what I did was on this slide, this is your index of each slide that follows. Rose Gallagher reviewed this. So I know everything in here is completely and totally accurate. This is a great review. So organs of the immune system, right? The cells of the immune system. Here's your immunoglobulins. Here's your hypersensitivity reactions. You can never forget about complement, right? As soon as I say complement, everybody should be yelling what? Oil. Opsonization, right? You guys remember this? Yeah. Types of immunity. Don't ever forget about your memory cells, right? And then here we talked a little bit about these as a smattering through what we've reviewed for the previous couple of hours. These are some common immunology and serology tests. Talk about immunization and vaccination, the types of vaccines. On one of the first slides, we talked about these toxoid vaccines. And that's all she wrote. Okay? When they start with you? 10 minutes?
10 minutes ago.
The last thing I always say to you guys, because I was one of those people myself, the night before you're taking this test, don't open any of your books. Have a good dinner, watch a movie, have a couple of shots or a couple of beers, and get a good night's sleep. When you get up in the morning, have breakfast. If you want to review a couple of things, do. Those last few hours before you go in and sit down and take the test are not going to make a lick of difference. What you know, you know. Don't stress yourselves out. The best thing you can do is be rested and feel healthy and good when you go in to take the test. All right, now, finally, my email is on the front page of that. I always ask for you guys, anybody, if you want to put it through Brandon or anybody else, or if you want to email me directly, let me know, content-wise, what was good, what we missed, what could be covered in more depth after you take the test. Because I always use that feedback to try and update this presentation and make it more valuable for you guys. Okay? Good luck.
Thank you so much.